So, hello everyone. My name is Dr. Hawari. I am a third year resident at Icahn School of Medicine at Mount Sinai in Queens, New York. In this session, we're gonna talk about how to prepare yourself for the interview season for the residency, especially for the internal medicine. That is the area of my focus here. So first thing, now we are in October 4th. Most of you guys, some of you maybe like got some interviews, some didn't get. So don't stress yourself about getting interviews now because interviews like you can get interviews until January. So still we have October, November, December, and January. So don't stress yourself and don't compare yourself by others. Like some of your friends may get interviews early, but they will not get anything after that, and you can get later than them. So everyone has his way. No, like we are not the same. So first thing, I want to explain to you, like before starting the preparation for the interviews, how to get an interview. How to get an interview. So some of you guys can send a letter of interest to the programs. Others can get interviews through some connections in the program, friends, or people worked with before. And some can get it through their credentials only, without any connections, without even sending letter of interest. So everyone has different scenario in this. So if you're gonna send a letter of interest, my opinion, you have to send it from now, and you have to make it personalized to the program. Don't send like a generalized letter of interest because I think like most of the program directors receiving hundreds of letter of interest every day. So if your letter of interest generalize it, most likely you will not get anything and just you are wasting your time in writing it. While try to make it more personalized to the program, try first to mention a good title to the letter. Like I can say like highly interested medicine or internal medicine resident applicant. You can write your ID, you can write your name in the title itself. After that, you can mention your name. And first, you can mention like the program director name, like dear doctor by his last name. After that, you can say, this is Ahmed, for example. I'm talking about myself. I am, and after that, you can say, I have applied to your program. Don't say just to your program. Try to mention the name of his program and try to mention how you heard about the program. Like, I heard from your resident that you are supportive and the good environment, there is good didactics, good scholarly activities, good research, whatever you can say, but try to mention something about the resident, like how you heard about the program and what you heard about this program. Then you can mention your credentials in brief. Don't talk about a lot about your credentials. Just talk about the strengths, your strengths. Let's say someone of you guys get low score in step one or low score in CK. I mean, like, don't mention something weak in your profile. Just mention the strengths in your profile because that is called a letter of interest. It is not your CV. In your CV, everything will be mentioned there. But in letter of interest, you have to mention only this your strengths. Like if you have like 50 publications, okay, mention that. If you have very high score in CK, okay, mention that. If you are first grade, mention that. But like if you are old grade, don't mention I graduated in 2010. So that is long time ago. Once he reads this in the first line in letter of interest, most likely he will not continue reading it. And why you apply to the program. So you have to mention something specific about the program. Let's say I'm here in New York City. So you like to live in New York City. What is present in New York City you like about? And you can mention also about the research. If the program has good research, you can mention about the didactics. If the program has good didactics, you can mention about the diversity of patients. If the program has that, you can mention about your friend is present in the area. You can mention about your family present in the area. A lot of reasons. You can read about the program, like you can open the program page, website, and if you find something specific not present in other programs, if you mention that, I believe he's gonna like you because no one will go deeply and read every program like this. And if you did that, he will say, "Oh, so this applicant is very interested in our program." Also, you should mention why you are the best fit the program. You can say like, you have home country work experience. You can mention that. You have good, not about the scores, but I mean like you have good communication skills. You are a team leader. Regardless, like you have to mention something makes you the best fit for the program. So in conclusion, letter of interest should be personalized. You can only like send one letter of interest, personalized, better than sending five letters but generalized. So for people that got interviews or when you get interview, so I receive sometimes a question like, when should I schedule the interview? My opinion, I believe in November and December, it will be a good time for scheduling your interviews. October, a little bit early, unless there is no time. Like, if they don't give you any other opening unless October or January. Okay, that's fine. But for me, November and December will be the best time because in October, it is the beginning. You're going to receive a lot of questions during the interviews. Sometimes program directors think like, there's better applicant will come after you, so they will not consider you highly. So I think better to be in November and December to schedule your interviews than in October. October a little bit early. January also a little bit late. So don't wait until they already catch what they want, then you will come very late. So the interview itself will be two halves. First half, they're gonna ask you some questions. Second half, you gonna ask them some questions. So don't make your interview like someone questioning you and you don't have any question for them. If you don't have any question to the program director and to the attending that doing with you the interview, sometimes they understand that like you are not interested in them or you didn't even look at them or search them. So try to find a good questions to them. And we will talk in detail about what questions you can ask. So let's say first thing. So first they do interviews with you because they want to test you about the communication skills because most of you guys have scores, most of you guys have research, most of you guys did US clinic experience. But the interview itself, they do it so they can test another side of your personality, which is the communication skills. Because most of the problems that happens after you start residency, it is a communication problems. Rarely to find a medical problems because we all have very good education. They gonna ask you and they do the interview just because of this thing. The other thing also, don't be arrogant about the number of interviews you will get during this season because someone can match with only one interview and others can match or cannot match if they got even 10 interviews. I know like 10 interviews means like you are 90% or 95% you're gonna match, but also still there is a possibility that you cannot match. So try to do your best in every interview you are get. Like if you got like only one interview, try to do your best. If you got 10 interviews, try to do your best in every interviews you will get. Also, don't use your phone during the interview. Like if you are talking with the program director, if you are talking with the program coordinator, or even of the resident, you have to show interest during the whole session and deal with any interview you got as it is the only interview you got during the whole match season. And don't be arrogant about that. And arrange the setting before the interview. So how you arrange that? So you have to make good lights beside you, and the camera should be in front of your eyes, and you can put sticking paper behind. Even sometimes I was doing that behind the computer, it's because some answers you may forget, like you are not remembering every answer they asking you about. So try to put like sticking paper behind the computer so you can remember some answers and some questions like especially for the most common questions like tell me about yourself, what is your strengths, your weakness, some kind of questions. I think it is repeated in all the interviews you will get. So try to Sometimes I put in some sticky paper behind the computer so I can look at it while I am answering, but it should be behind the camera itself. So your eyes still be looking at the camera. Now I'm gonna talk about some commonly asking question. After that, we're gonna start the session like one-to-one, asking and answering every one of you guys. So one of the most important question you're gonna get, which is tell me about yourself. Most of people like in the beginning, okay, tell me about yourself. So don't start like, okay, I am Ahmad. I graduated from medical school and this and that, and I did research and I did work. All of this present in your CV. But they ask you this question to know who are you? Who are you as a kind of person? Like I can say when they was asking me this question, I can say like, okay, this is Ahmed. I am a person that learning from other people experiences. I'm trying every day to read about other experiences and try to improve myself regarding that, trying to avoid their mistakes and trying to do better. A little bit about myself. I born and raised in Egypt. I did my medical school in Egypt. I graduated in this year. I did after that home country work during this year, like, for 5 years, for 4 years, whatever. And after that, I came to Mayo Clinic. I did research. After that, I came to New York. So I mean, like, talking about yourself, not only about your CV, your credentials, but also you have to talk about your personality, and also you can talk about sometimes about your hobbies. Don't forget to mention something about your hobbies. Like I like to go to the gym. I like to do fishing. I like to go hiking. Whatever. Regardless, you have to mention some hobbies during or in the answer of a question. Tell me about yourself, but also try to be honest, try to be genuine. Like, if you are not going to the gym and you don't have muscles or something, if you tell them like, okay, I'm going to the gym, I mean, like, if I look at you, okay, you are not going to the gym. So try to be honest about the answer you are giving. Second question, why you choose to join medical school, and third question, why you choose internal medicine itself. And we're gonna talk in detail about both things and later. And also, they're gonna ask you about your strengths and your weakness, and they're gonna ask you why should I choose you. Like you can say, you can choose me because of the research, home country work. Sometimes you can talk about your language if you have a good language. Like I'm speaking Arabic, so if I'm working in Michigan, a lot of Arab communities there, so I can say okay, and I'm speaking Arabic, so I can help with the patients there. And if you have tutoring also, so all of these kind of strengths you have to mention, and that is why they should choose you. Also, they're gonna ask you about if you have any disagreement with your mentor, with your co-worker. So in such situation, it is a little bit tricky questions. So you have to acknowledge the problem. You have to look at the reasons why this happened, and if you are wrong, you have to apologize. So try to be very modest in such scenarios. Also try not to talk a lot in these situations. Just tell him like I can apologize, and you have to acknowledge the problems, and you have to look for the reason why you did that. Also, like it is not good to say that you did a mistake, that you harmed a patient, because you are applying for a medical job. So if you are has a history that you are harming your patients, so that is not good, and no one gonna hire you. So if you have a problem before, so try to focus more on communication skills. Most likely it happens. It happens more even than problems that harming patients. So don't, because that's like, in my opinion, that is a red flag to mention that you harmed a patient before. Even if you did, I mean, like, but not everything you did, you should mention. Why you choose our program also, they're going to ask you this question. So you have to study the program very well. You have to tell everything present in the website and focus on things that not present in other programs. Some programs like have international rotation. Some program has wellness days. Some program has I mean, like, a good didactics or good research, diversity of patients, whatever. Regardless, try to look everything about the program, or and look at the schedule even of the program, and try to mention, okay, I like to apply to this program because the scheduling is a good fit for me, or I like the schedule in the program. I like the clinic 2 weeks, 2 weeks, or like 1 month, and after that I have floors 3 months, regardless. So look at the schedule and see what exactly make you apply to this program. I know, like, you apply widely because at the end of the day you want to match, but they don't want to hear that. They want to know exactly why you like our program. And the program don't offer research. My opinion, don't talk a lot about your research experience. Just try to mention a little bit about your research, but sometimes, or some applicants like take about maybe 10 minutes, talk about what they're doing in research, and at the end of the day, the program, they don't even do one publication every year. So uh, they will not like that because they feel like, you are talking a lot about something that we don't have in our program. Also, what is your future goals? So also the same thing. If the program don't offer or don't have fellowships, my opinion, try to focus more on being a hospitalist. But if they have in-house fellowships, so it is good to say like, I'm gonna apply for fellowship if you want. But if you don't want, that's fine. You can say also, I'm gonna continue as a hospitalist. Regarding the hobbies, so only mention the hobbies that you have experience in. Don't lie. It happens with me one time while I was in one of the interviews. So they asked me about my hobbies, and I started to talk about fishing. Yeah, I did fishing before, but I'm not experienced in this hobby. So he started to ask me like, what kind of fish are you catching from the sea or from the ocean and this stuff. So I start to mention some names of fish which is not present in the Red Sea while I was in Egypt. So he recognized that maybe I'm lying. So that is the thing. So if you don't have a good experience in this hobby, don't mention that. Try to only mention the hobbies that you have very good experience in. Because sometimes the interviewer may be interested in the same hobby. And as in this point, so you're gonna stuck with a lot of questions. Regarding the behavioral questions, which is the most challenging and the tough part during the interview. So they will ask you about any conflict you did or any disagreement happened with the resident or with the staff. So in this situation, as I said before, try to be modest. Don't talk a lot. Just acknowledge your mistakes and understand patient concerns, understand the concerns or what happened from your colleagues. And after that, you can apologize if you did mistakes. And also during the interview, try to be neutral. Like don't be with or against 100%. I always accept other people's opinions. And as I said also, always during the interview, you should smile. Should smile regardless. Like, from the beginning to the end, you have to be like, cheerful and prepare yourself to questions like challenges happen during medical school, challenges happen during work. If you don't have any challenges, try also to think about one because they're gonna ask you these questions. And regarding exams, my opinion, don't mention that you failed any exam unless you had it and they asked about that. So if no one asks you about why you failed the exam or something, so don't talk about something weak in your CV, even if it happened. But I mean, like if they asked you, okay, you can start talking. Also, don't talk a lot about your weakness. Don't say anything related to professional malpractice because you're applying, as I said, to medical job. So if they're asking about malpractice that you harmed a patient or something, you shouldn't mention anything about that. Just maybe you can say like about patient miscommunication, which is acceptable. Um, Also, they're gonna ask you about positive and negative patient interactions. I think we all have positive patient interactions before in our home countries. You can mention one or two of what happened before. Negative interactions. I'm trying to avoid also medical mistakes, only communication mistakes can happen. Sometimes I was mentioning like patient did a blood test. After that, the patient or the nurse called me. The patient asking about you to come to explain to him what is the results of the blood test. So at the time, I was doing an admission and I forgot to return back to the patient to explain to him what is the test results. So the patient was angry about that. So it is a little bit communication mistake, but I didn't harm the patient himself. So they're gonna ask you also why you came to US. So why you are leaving your home country? That is a legit question you may get during the interview. So if you got this question, you can talk very good about your US experience. Like you can tell like that is the best training in the world, and I have friends in US. I have family in United States, which is very good thing. But also to not or try to avoid talking negative about your medical school or your home country. Like, don't mention anything bad about it because at the end of the day, you are part of your home country. So don't say like, okay, I left Egypt because medicine in Egypt is not that good. Okay, no, that is not acceptable at all. Don't say that. Just say, I am going to US because US has one, two, three, four, nothing else. Also, that is the like the 50% of the interview. The other 50% of the interview, they're gonna ask you like tell me a question, ask me a question. So you have to prepare some questions directed to the program director, some questions to the faculty member, and some questions to the resident. Very important to prepare good questions to them because depending on these questions, they're gonna choose you to enter the program or not. Like some of my interviews, I was asking the program directors about even their journey, where they did the residency and how they like it, how they like the cities and the stuff. So all of these questions, like people like to talk about themselves. I like to hear from them. If I ask the program director, like one of them was did his medical school in Alaska. So I asked them like, why you went to Alaska? Alaska is very far and very cold. So he started to talk like, like in a friendly manner, why he choose to be there, which is good thing. So before starting or before doing the interview, my opinion, you have to look at the people that you're gonna do the interview with. You have to study exactly, as I said, study what they did in their life. Like if he did ID fellowship, if he did gastroenterology fellowship, if he didn't, if he is a hospitalist, and where he worked before. When you know this about him, so you're gonna know exactly what kind of questions you should ask. Uh, because like let's say you are doing interview with Italian program director, so okay, you can, if he ask you like what kind of food do you like, okay, I like pizza, okay, because Italian for sure. So I mean like when you talk with a program director to try to also to know where he is from and what he did in his life. That is very good. And if you understand the people in front of you, the people that you're doing interview with, easily you can get the job. Also, ask about something not explained well in the program website. If you're gonna ask a question about the program, try to ask something not explained. Don't ask like what is the schedule of this? Okay, but it is explained already in the program website. And if it is explained in the website and you're just asking it again now, that means even you didn't search us or you didn't even open the website of the program. Try to ask maybe about the mentorship program, ask about the evaluation tools, how can they evaluate you, how you will evaluate the seniors, and you can ask about the wellness program, you can ask about the research in the program, if they have or if they offer research. But if you know that the program is small and they don't do research, so don't ask these kind of questions. Also, you can ask about the fellowship if they have, how can they gonna support you to get a fellowship if they have in-house fellowship. Also, you can ask about the board exam, how they gonna support you for to do while you are doing the board exam to succeed it. Also, you can ask about the schedule. I mean, like not the general schedule, but if something not explained, you can ask this kind of questions. You can ask how to be a good resident. I mean, like that is all people ask this question, but also it is valid. You can ask it. And if you have a meeting with the resident, like meet and greet and this stuff, so you can ask the resident, can you walk me through a day? So what you're gonna do from the beginning of the day until the end, from 7 a.m. until 7 p.m. So they're gonna tell you exactly what they are doing during work. Um, very important, very important. Your English should be fluent, clear, and always, as I said, always smile. The interview itself, it is not about the answers. Most of you guys will say very good answers, but it's about how you speak, how you talk. Am I understanding you or not? Because if you have a very good answer, but your accent is very heavy or we cannot understand each other, so most likely they will not rank you very high. So now uh, I did in brief the what they're gonna ask you, and I wanna start with everyone. Like I'm gonna choose one by one to ask some questions, and just the ones that I'll mention can open or she can open the mic and answer the question.
Hi,
This is
Ahmed, a quick question. Can
yes.
I? So where I will be working in Wyckoff Heights as a house physician. So let's say if my interview is scheduled in morning, so can I put on the Wyckoff scrubs or do I have to put in formal shirt and coat?
Yeah, you have to be formal. You have to wear like if you are a man, you have to wear a suit. If you are a woman, you have to wear like that is official interview. You shouldn't wear scrubs in the
Even if
interview.
I am on workplace, right?
Yeah, you have to take off this day.
Okay. All right.
Right. Great. So let's start by the first question. Um, I'll choose one. Anyone choose? I just unmute yourself. So let's start by Israt Jahan. Tell me about yourself.
Hi, can you hear me?
Yes, I hear you.
Hi, I am Israt. I grew up in a village at Bangladesh, which is a small village like island. And I have graduated from Khulna Medical College, which is a tertiary level hospital in Bangladesh. And there I did my internship for 1 year, which helped me to build my clinical foundation. After my internship, I worked as a primary care physician for 5 years. Then, when my husband immigrated to US, I accompanied him, and I wanted to get me involved with US system. Then I started my masters, and I completed my graduation. That time, I had the opportunity to improve, like work collaboratively with my team, and which helped me to improve my communication skill and also my teamwork capability. For last 2 years, I am working as a clinical research coordinator at Oregon Health and Science University in a big team of 40 people, where I am leading multiple drug trial, which is helping me to directly connect with the patient, understand the patient needs, and also make me very much adaptable with the US healthcare system. And as a person, my friend used to say me like very easygoing and adaptable person. And I love to travel a lot and to explore different places, different landscape, and different cuisine. And I'm a mom of a kid, and in my leisure time, I used to play with my kid. I love to spend time with my husband as well. We used to roam around and explore different places. Yeah, so that's all about me. Thank you.
Okay, great. So just I'll do a comment about your answer. Also, from the start now, no one take it personally, just we are correcting each other. So, what I'm saying first, good thing that you didn't mention your year of graduation, which I believe it will be our old grade. So
Mm-hmm.
good, not good not to mention that, okay?
Mm-hmm.
Because the second thing you should mention like something about your hobbies if you have a hobbies.
Mm-hmm.
Um, Third thing, before starting directly by your name, after you mention your name, just mention a little bit, like a little bit quote about yourself before starting what you did in your life. That is my comment. Like,
Can you repeat it, please? Like I might miss.
uh, I mean, like you should mention like a little bit of quote, like, about yourself, like before starting, like I graduated from this medical school at this year.
Mm-hmm.
You got my point? So yeah,
Yeah,
mentioning this, I think it will help to understand what is your personality before going on and mention your credentials.
got it. Got it. Thank you.
Great, you're welcome.
So I have another question.
Yes,
So, I in my like introduction, I mentioned about traveling as my hobby, and I also
yeah,
mentioned it
it's
in my
fine.
Iraq CV as well. So, do you think that traveling can be a hobby? Like I mentioned it in my CV.
Yes, traveling is a hobby, but I mean, like, when you travel, what you are doing there, you're going to restaurants, you are visiting new places. What places did you visit? You can mention something like about that.
Like, got it, got it. Thank you.
You're welcome. So let's go to the next. Abdullah Ahmed.
Sorry, can I ask a question?
Oh, okay.
Sorry.
Okay, no problem. You can ask.
Yeah, so I was under the impression that in the elevator pitch part, the tell me more about yourself part, we were supposed to just have like a really succinct, introduction about ourselves, not to delve so deep into I did that and that and that. I thought it was supposed to be, I just say, yeah, I graduated from the school. I grew up there, and then I like to do like I explain my character. I'm like, I'm dedicated to learning more, and then my hobbies, and then that's it. Because I didn't know that. Are we supposed to just technically just go over our CV?
So usually it depends on the interview itself. One of my
Mhm.
interviews, the program director was just looking at my CV. He didn't find it. So he left me for about 5 minutes just talking. So okay, I can mention. So it depends on the person in front of you, how much time he gonna give you to answer this question. So you can know this from his eyes, like, if it is in hurry, so just can mention it in 1 minute only. Don't talk a lot. Like, for me, I was taking, okay, I graduated in this year. I did 5 years working in Egypt. I came to Mayo Clinic. I worked for 1 year. Done. So I can mention something about my hobbies. I can mention about my research. It's fine, depending on the situation. And if I mention about my research, if I have more time, I can talk in details what I'm doing in research. If I have more time, I can talk in detail about my hobbies. So try to make the interview not just question answer. Try to make it as a friendly manner. You are talking and he is receiving. Try to understand something because he's doing about 10 interviews per day or 20 interviews. So he talked to a lot of people. Maybe he is not focusing with you. So your job is to make his attention with you. Make him so to make the person in front of you has yeah, yeah, you catch his attention, you have to mention something specific about him.
Thank you so much, doctor.
You're welcome. So I just there is a question, what kind of quote? So as I said, in my situation, I was just saying I'm a person that learn from other people experiences. So I'm gonna learn from others' mistakes, and I'm trying to avoid it. So just an example, I'm saying. Uh, okay, so let's ask the same question to Abdullah Ahmed. Tell me about yourself.
Hello, Doctor. How are you? How are you?
Yes, I'm doing good.
This is Abdullah Khataba. I'm from Jordan. Um, my journey started when I was selected to study medicine as a full medical scholarship at Ain Shams University, where I spent a full 7 years of medical training that was combined with dedicated hospital rotations and very wide exposure to patients. I particularly was interested in neurology when during these rotations, and I had the chance to do some neurology research, which also gave me more attention and more exploration of this field. And those research projects get me to know some doctors in the United States who invited me to do neurology rotations with them as well. And by seeing real life experience, watching them how to treat their patient, this is where I see myself, and this is why I applied to neurology. On my personal life, outside of medicine, I really enjoy horse riding and playing chess, and I feel that this is the way that I can relieve my stress, especially after a very busy day. Yeah, this is what I can think of right now.
Right, this is great. This is good answer actually. You're doing good. The same as I said before, like a little bit of comment, like try to be maybe a little bit faster in talking. So, but your answer is very good. Your answer is very good. Let's ask the next question. How your friends describe you? I'm gonna choose now Adora, Mocha, Adwara. I'm sorry if I pronounce your name wrong. So, how your friends describe you?
My friends would describe me as somebody that's dependable, that they can always count on to keep their word. My friends will also describe me as somebody that's driven, that sets a goal and accomplishes the goal. In addition, they'll describe me as a cheerful person. I never let anything bring me down, and I always bring light into any room I come into. Yeah.
Right, great. That's a good answer. Okay, great. And the same question for Ali Hassan, how your friends describe you? If Ali not here, let's go to the other one. Al-Riza, so how your friends describe you?
Hello, good afternoon. Thank you for the seminar again.
Yeah, you're welcome.
I can say my friends describe me as someone maybe ambitious, dependable, and a hard worker.
Yeah, great, good answer. So, guys, also this session, we all like now about 42 people, 42 persons. So, if you like an answer for other colleague, you can write it down. You can learn from it. That is why I made it as a group, not as a personalized, so everyone can learn from the others. All right. So let's ask the next question. Tell me something interesting about you that not included in your CV. And this question will go to Amara Faiz. Tell me something present, like about you, but not present in your CV. Okay, let's go to the next one. Amr. There is two Amr. Amr Shaker, and there is Amr without anything. So anyone here can answer.
I always like to,
Amr
uh,
Shaker, yes.
yes, I always like to be updated with evidence-based medicine resources like UpToDate and Clinical Key for more focused medical care and updated care for guidelines.
Okay, Amr. Okay, I'll ask this question to another one and I'll comment on both of you. So, Aisha, can you also answer this question? Tell me something not present in your CV. So we go to the next one. Chetrish, tell me something not present in your CV. And it is about you.
Hello.
Yes.
Hi, Lovery. Thank you for the question.
You're welcome.
Um, Something which is not in my CV, I would say I have really good attention to detail, so I can talk about any car's specification by just looking at the wheel cap.
Okay. So, in general, how can you answer this question? I
Mm,
like this question to answer according to your hobbies.
mm,
Like you can mention about three hobbies in your CV, okay? Try to mention something hobby that not present in your CV, but you like to do it. Better than saying like evidence-based medicine because we are all following evidence-based medicine, and I believe in your CV, most likely you're gonna follow that. Um, Try to mention something not present in real. Like let's say you mentioned in the CV that you're going to the gym. Maybe you mentioned you like to travel, but I believe there's some hobbies you do, but not everything you mentioned. So try to say something regarding the hobbies. I think it will be an opening for a conversation. Then these answers. That is my opinion. Also, I'm not judging. Just I'm telling my opinion regarding this kind of questions. Okay.
thank you, Dr. Lovery.
All right. All right. You're welcome. Mm, so let me ask the next question. It will be to Dua Abdul Karim. So tell me what you did from the time of graduation until you applying to the residency. If she is not here, I'm gonna go to the next one. Ines is Ines. So tell me what you did from the graduation until you are applying to our program.
Doctor, please, can I
Yes.
ask a question?
Yeah, sure.
Is it good if I mentioned unsupervised medical care in private hospitals in Egypt as a house officer or any stage that I'm not officially allowed to?
So can you repeat again? You supervised medical students?
Unsupervised medical care.
Like you know you are answering the previous question, right? Things that you didn't mention about in your CV.
No, I mean that I'm not officially to provide unsupervised medical care as a house officer, but I worked in private hospitals. Can I mention that?
You can mention only if you are certified to work. Like if you have a certificate to work in your home country, you can mention, but don't say like I was working while I was medical student or I'm not certified. So that is illegal, right?
Yes, yes.
All
Thanks.
right. Okay, great. So I'm gonna ask now the next one, next question. Um, it will be to Al-Gharabawi. So Al-Gharabawi, tell me what you did from your graduation until you applying to the residency program.
Okay. thank you for the meeting first, and thanks for the question. I have a busy years from since graduation. I have studied for the steps exams, and I have been preparing for my marriage, and I get married and I got a child. And during this
Congrats.
period, I have a lot of schedule. Thank you. And I have a lot of schedules as always, as I am a multitasking person a little. I'm a sportsman, and at the same time, I have a lot of hobbies and a lot of friends. I can say about myself that I'm a bit job advisor, organize trips, and let people know each other, and I can go easily with people. So I think my schedule is always full, which is a thing which I can talk about, I think.
Okay, so that is great. I
Right?
think you should
Mhm.
mention when you graduated. I didn't catch it. You said the year or not?
No.
Okay, so you should
It
mention
was
when you
2022.
graduated.
Okay.
So you can say like I graduated in 2019, for example. Okay, and after I did my
Yeah.
graduation, I did work in this area or this like this hospital. And during that time,
Okay.
I was studying for USMLE. I was
Okay.
married also. I have children now. So that is a good thing that you
Hmm.
mentioned something about your personal life. I mean, like, something that in a friendly manner
Yeah.
while you are talking. That is
Okay.
very good. But just try to arrange the answer in a timely manner.
Yeah.
All right. So to be
Okay.
more easier to the person in front of you to
Okay.
understand.
I was a primary care physician for 3 years, so
3 years.
I'm ashamed to
Yeah.
talk about this this situation, or I can talk about it. What's your opinion?
Yeah, being a primary care physician is fine, but I mean, like, try to mention, like, I was a primary care physician in this hospital, this area.
Yeah,
So,
I didn't mention it as I don't know how to talk about it. If they ask me why have you been working for three
no,
years
no, no,
as a
that's
primary care
fine. That's
physician,
fine. I mean, like,
I cannot answer. Yeah.
so what I was, because I was in your situation before, I was a primary care. So
Okay.
they
Great.
asked me before why you didn't do a residency in your home country, why you were only a primary care physician. So I was
Hmm.
answering them like, and why a person do two residencies in his life. Residency is tough. So if I did in US, so I shouldn't do in Egypt. Yeah. Try to be honest.
Okay. Great. Great
Okay.
answer. Okay. Thank you. Thank you for your time.
Great. You're welcome. So let's ask the next one. Um, so we'll go to Ilham. So why should I choose you in my program?
Thank you, Ahmed, so much for this session. So practically, I should talk about my strengths. I'm really like a good physician. I worked in my home country for 8 years. I worked with people in underserved area. I advocated for women's health, and I used to teach children in underserved area about health, hygiene, and why we need vaccinations. I'm a very dedicated person. I work very well with teams, and I am experienced as well, and I am open to learn new things. Um, and I think that's why you should hire me in your program.
Okay, so that is good. But my opinion also, when you answer this kind of questions, why should I hire you? Why should I choose you? I'm the approach is like when I'm approaching this, I'm just try to talk in a little bit modest way. Like I can say, as you know, most of the applicants has good scores. Most of the applicants had good research.
Yeah.
Most of the applicant has US clinic experience now. But what makes me maybe outstanding, you can mention more about your home country work experience. You did a lot, so you can mention a lot about, more about that. You can mention more about the language itself. If you are like, the program coming from an area that is speaking your language, you can say, oh, I'm speaking my native language is this, and the program present in areas that have very big patient population coming from my ethnicity of my country. So I mean, like, You can mention one or two things that makes you an outstanding, but also try to mention that most of the applicant had everything. So I can understand from this answer, okay, you are very modest person.
Okay, thank you so much.
You're welcome. Let me go to the next one. So the question here for Iman Makki, what you gonna bring to our program?
So I don't know the difference between this question and the previous one.
So the previous one, why should I choose you? This one, what you gonna bring? Like you're gonna bring the same. You'll talk about yourself also. Like, you can say, I had 4 years like working in my home country. So I'm gonna bring this, I'm gonna bring that. So you can tell also. Sometimes I'm asking the same question by a different way.
Okay, I'm a recent graduate. I don't have much experience in the workplace, so I can't really say that. So I was going to go over like my personality traits.
Okay, you can talk about this. You can talk about medical knowledge. You have a good medical knowledge. Um, what else? You have research or not?
Not that much, no.
Mm. So if you have research, also you can talk about your research. Anything is strong in your profile, you can talk about that in such a question.
Mhm.
All right, all
What
right.
if there's nothing that particularly makes me stand
You
out
have
in
to
my
find something because you need the job. You need
okay.
you need to be hired. So you mean like, you have to talk about something. Even if you worked for 1 year in your home country, try to mention that I worked for 1 year. Or even if you have good scores, I have good scores in USMLE.
Okay.
I mean, like, I don't prefer like to mention scores because the scores doesn't matter anything, but you can talk about your communication skills, sense of humor, anything. Oh, yeah, that's fine. But also on academic side, you have to have something in your CV.
Mm-hmm. Okay. So should I say something or?
Yes, yes. So as I said before, like, just mention the things that specific or unique in your CVs. So, and also you can talk about your communication skills.
Um, so I have a good step two score. I also have experience teaching because I'm currently a microbiology demonstrator at my university. So I can help with the junior residents or the medical students. Um, I'm also dedicated to always learning and improving myself and working on myself. Um, I
Yes,
don't know
that
what
is
else to
that is
say.
that is great. That is great. You're answering good, but just I'm giving some ideas what you should do.
Right.
And regarding the message, I'm gonna answer all the messages, but just after I finish the questions that we are practicing now. Okay.
Can I,
Okay.
can I,
So yes,
sorry, can I try to answer this question?
yeah, sure, you can answer.
Yeah, so I do have a background, a home country residency, and I'm working here in the US. So the way I answer this question, so for me, I do bring a strong clinical foundation built through both international and US healthcare experience, which allows me to adapt quickly and work effectively in a diverse clinical setting. Given that I do have a home country clinical experience in both rural and urban settings, through my journey, I developed the resiliency needed to handle the day-to-day challenges as a resident, and I approach these challenges with positive attitude. And beyond that, I have a genuine passion for serving underserved populations. As back home, I worked mainly after graduating from residency. I worked mainly in underserved areas. It's mainly this.
Okay. So try also to your answer is good, but depending on the program you're applying for. Like let's say you're programming in the city area, like my program in New York City. So if you said like, okay, I'm working in underserved area, it will not help. So this answer could help if the program present in a rural area. So it will be very good. So depending on the program you are interviewing with, you can change and work on this answer. But if you are like interviewing with a program here in New York, you can say like I have a very good and about 4 years of home country work experience, and I'll bring this to the program. I have a research experience. I'll bring this to the program. I'm speaking multilingual like English, Arabic, French, whatever like you speak. So you can also I'll bring this to my program. A lot of stuff.
Okay, thank you.
Right? Great. Let me go to the next question. Ishita. So for Ishita, tell me about your volunteer work.
Thank you for that question. I have got extensive experience in volunteer work. So when I was in med school, I participated in the Pulse Polio campaign, where we went from home to home and gave polio drops to small kids. Other than that, after graduating from medical school, I participated in an organization called Switch India, and we mainly dealt with health camps done in the slum areas of Mumbai. We also ran deworming drives and free generic medication drives. One interesting thing that we did was we were the first organization to launch a healthcare camp for the trans community in India. And we were supported by the government to do this. Other than that, I am a talented graphic designer, so I have worked with few organizations which do nonprofit work in order to escalate their messages on the internet with the help of my pamphlet making skills and social media skills. Lastly, I worked with many organizations which were involved in organ donation because somebody very close to me was on the transplant list, and as a result, I'd really worked to bring up the organ donation rate in my country, which is the lowest in the world currently.
Right, that is perfect answer. Great. Let me ask the same question to Muhammad Muhi, Dean. Yes.
Hi, Dr. Hawari. Thank you for having us today. Actually, I started my volunteer work since medical school. We have organized some teams to raise money to bring some deficient equipment in our university hospitals, and some for social support of some of our students. And after that, when I started residency, we did a campaigns in Egypt under the call of 100 million health, which responds to the population of Egypt. We went through Egypt and all over Egypt, and we did a scanning for hepatitis C, which is endemic. And after 3 years, Egypt is declared about 99% of the population are cleared of Egypt. And this got a golden medal from the WHO. And after that, I joined an international committee called the Syrian American Medical Society, which helps Syrian refugees. We went to Jordan, and I went to the Zaatari camp. It was a devastating experience. We met about more than 100,000 of Syrian refugees in underserved community, devastating health conditions. It was a real experience that enriched my sense of human being and someone who has a message in this world, especially for those people who fled from war and the rest of it. That's so far.
Yeah, that's great. Good answers. You are doing good. Um, Let me ask some of you guys who has research experience who want to answer this because not of you guys have research. So if I ask, tell me about your research experience. Who want to answer?
Hi, my name is
Yes.
Sultana. Actually, regarding research, I have a question because I had experience case report writing, and I published in my home countries as a very renowned journal. And I have two. I have published two case report, and I have worked in a group here to write an abstract, but the main paper is not published yet. And I had two poster presentation in local convention. So can I mention? How can I mention those experience?
So you are working here in United States in research, or just you are doing the abstracts? No.
Here,
Yeah.
here I just worked on an abstract writing, and the main paper writing is not done yet.
All right. But you are
And
not
about
working. You are not working in an institution, right?
no, it's like
All
it's a
right. So in
volunteer.
such
It's
a
under
situation, just you can talk about, the name of the project, like if it is meta-analysis, if it is cohort, regard whatever,
Mhm.
name, type of study, and what is the criteria, inclusion criteria, exclusion criteria. So what I'm saying is you have to, like, I don't know anything about your research now. So you have to make me understand that you are doing a good research. You are doing something important for the patient. All right.
Mm. Mhm.
So tell me, like, I'm working on a study regarding this disease, and this disease is very rare. And the inclusion criteria for our study is this, exclusion
Okay.
is this, and the
Mhm.
result is that. You understand?
Okay. Mhm.
Yeah. If it is a case report, just you can talk about the case. Like, while I was working in this hospital, patient came, patient has these symptoms, one, two, three, four. Lab finding it was that, imaging finding was that, and the conclusion is that. You understand? That is how you write a case report. So also you can tell about your case report in about 1 minute or 2 minutes.
Mm.
You
If they
understand?
ask me questions about do you have any research experience, then I will mention all of them, this case report and abstract.
You can mention the most important publication you have. I understand?
Mm.
Because no one has the time to tell me if you have 10 publications for sure. You cannot tell me the whole work. But just tell
Mhm.
me, like when I was working at Mayo Clinic, I only was mentioning the cohort studies, the clinical trials, but not case reports for sure. Okay?
Oh,
So
okay.
just mention the most important thing or start by the most important thing. If you have more time, you can mention everything. But I mean, like, they will not give you all the time to mention everything. Um,
Mm.
but
Thank
this
you.
question, it was directed to someone already working in a
Mm.
research institution.
Okay.
So if you are working in like Mayo Clinic and University of Minnesota, University of Florida, whatever, like, you are doing research, so you can mention more about what you are doing every day because at this point you have a job. So it is your job. So you have a lot of things you can mention. All right.
Sorry, I have a question.
Yes. Yes, sure.
So, I'm not working as a researcher in an institution, but I have a research publication which I was involved in. I was not also the first author, but I contributed to this. And in case I get asked about it during the interview, what if I don't talk about the inclusion exclusion criteria, but just talk about, what kind of studies was, its titles, and also what my role was in that research in particular, and how I collaborated with my friends, what I learned from it, and what the results were and how it helped,
Yeah,
the population. Could this be a proper format?
yes, but the thing else also you have to mention your rule. That's what I said, and I think you said that. So what you did, you wrote the manuscript, or you collected the data, you did the analysis, and it depends on the kind of the study. If it is a case
Mhm.
report, if it is a systematic review meta-analysis, if it is cohort, if it is clinical trial. So I mean, like, if even if you are not working in a research institution, but you have something in your CV, and you should mention your rule, what you did, and how much time you spend in this,
All right. Thank
right?
you.
Great. You are welcome. So let's go to the next questions. And I'm gonna choose one now. So Let's just choose Ravi Kumar. Ravi, tell me about your weakness.
So I think one of my weakness is me being a people pleaser. I naturally want to make people comfortable, and so which may sometimes lead me to saying yes to the things that I do not want to do, which can lead me to feel being overwhelmed as well as drain my energy. Over time, I have started to balance it by prioritizing my responsibilities, setting healthy boundaries, and being assertive while communication. So that's how I am working on this weakness I have.
Okay, this is good. And let me ask the same question to Fariel. So tell me about your weakness. After that, I'll comment on both. Okay, I'll go to the next. Hazim Elbaz, tell me about your weakness. Um, I'll go to the next. If Hazim not here, Jose Fuentes.
Sure. Hi. Thank you for the opportunity.
All right.
Honestly, I haven't really thought about this question a lot, but right off the bat, obviously, I can say that just thinking about what pops into mind right now, working, for example, in research projects, I may probably have problems like delegating and like I tend to do more stuff myself. Like just trying to make sure everything is all right. And I think this is a weakness, obviously, because you can get overwhelmed with a lot of work that you're not like literally even supposed to be doing. So obviously, what I'm trying to do with this is, try to trust a little more with my colleagues, delegate much more, give like clearer instructions so that I can focus on my work and everyone else can focus on their work and we can work better synergistically.
Okay, this is great. So what I'm saying regarding in general weakness, we don't no one like to talk about his weakness. I totally understand that. Even me, when they were asking me this question, I was just taking about 10 seconds to mention, okay, one weakness and I explain it a little bit in one or two sentences. Like I was saying, like, I am a detail oriented. Sometimes because I am concerned, I'm looking at the details of the project, as Jose said, like, I'm looking at the details too much. This sometimes takes from me a little bit more time to finish the project. But now you have to mention, don't stop. You have to mention, now I am working on that and I'm finishing my tasks in the appropriate time. So even if it is a weakness, you have to mention that you are working on this. Don't just mention, oh, okay, I have weakness and stop. No, you have to mention, just you are working on your weakness and you are gonna do better. Okay, so any one of you guys that have a gap in his CV? Because the next question, why you have a gap in your CV? But only for people that have a gap. Ishita, okay, you can answer.
I actually had a question about the
Okay,
previous
okay,
question.
sure.
So, somebody told me that when you talk about your weaknesses, you should address the red flags you have on your CV. Let's say, like you have maybe a lower score in one of your steps, or maybe somebody has like I mean, less research experience compared to the type of program they're applying to. So can they talk about that as their weakness and what they're doing to improve it?
I mean, that is academic thing. We all have, no one have academic everything. Like, you may have low scores, but if I'm interviewing with you and you remind me that you have low scores, So he forgot, so don't remind him. Okay, so my opinion, um, the real weakness scores research. This is a real weakness. So don't mention that. Mention something that he will forget after the interview.
Okay, yeah,
Okay.
makes sense.
All right. Great. So anyone has gap here in his CV? Can explain to
I
me
have,
why?
yeah.
Okay. So explain to me why you have a gap.
After I graduated and finishing and started my intern office year in UAE, Sharjah, I decided that I wanted to move to the US. And since I moved there, I started studying on my steps, and I was working at the same time. Even though there was some periods that I wasn't clinically active and working on non-clinical things, I always tried to kept clinical experiencing by having some volunteering in a diabetic clinic. And after finishing that, I also work in an urgent care right now. And once I was all ready to apply, and this year I'm applying to internal medicine.
Okay, that is a good answer, Tariq. So my only comment on this answer is you have to mention to him, like you have to remind him, he knows already. You have to remind him that I immigrated to US, whatever. I traveled to US. When I traveled to US, I am not allowed to work in medicine because I am not a licensed physician, as you know. So that is why I was working on something else until I did my steps exam. Then I applied to the residency program. All right. So just remind him that you have a gap not because you don't want to work in medicine, because you are not allowed to work in medicine.
Okay.
All right. Great.
Thank you.
You're welcome. Um, so who is here in old grad? Anyone old grad here? More than 5 years? Let me ask this question to this one.
I'm
Okay.
2019.
19, not all the grade, but like, let me ask you this question. Do you think your age will make like you can or you cannot make the tasks that can be done by your young colleagues? Is it difficult to return back as an intern after finishing your training in your home country? That may be another question. Like, sometimes all the grade, like let's say 10 years all the graduation or something, he's now attending in his home country. So now if I asked him, um, are you gonna listen to people like younger than you or not? That is the main idea of the question. So you should answer. How you answer this question?
So I think, in my opinion, it's not there is no difference between old grad and fresh grad, because old grad has the opportunity to get more experience. Like me, I have teaching experience. I was teaching assistant in pharmacology. I get experience in research, academic research. And when I moved to United States, I did rotations in different clinics. So I got US clinical experience, which make me different and stronger. So I think there is no difference between fresh and old grad, in my opinion. So
Okay. So the way I'm answering this question is, you can say, yes, I graduated in 2018, 2017, just I'm mentioning, like people old grad. But during that time, I wasn't sitting in the home. I was doing exams. I was also working. I have PhD. I have masters. I did home country residency. So I was improving. So the thing is, or my definition of a gap is I am not doing anything during the time. But for me, in my scenario, I was doing a lot of stuff. Like I was doing PhD, I was doing masters. So if you are doing something else, so that is not a that doesn't mean anything. Yeah, I am graduated all time, like long time ago, but still I'm doing something else. All right. So just in such scenarios, focus more on what you did during these 6 or 7 years in your life. All right, which you're answering it by the correct way.
thank you.
Taking exam is a good excuse to a gap. Just I find this question in the chat. Um, Taking exams not a good excuse actually because we all can do the exams, so you can mention something else. Like, I was doing the exams, but also mention about your work, what you are doing to work. All right. So let me ask this question to Yazan. Yazan, what do you want to change in yourself? Are you here? Okay, let's go to Ragd. What do you want to change in
Hello,
yourself?
Dr. Ahmed.
Yes,
I'm
Yazan.
sorry for
Okay,
the
Yazan is here. Okay,
sorry.
you can answer.
So it's a great question. One thing I would like to change about myself is that I used to find it difficult sometimes to say no when my friends or my family ask me for something. So, for example, my family invited me to a social gathering about 10 days before my step 2 exam. So before that, I would have gone, but nowadays I have learned to prioritize my responsibilities. So at that time, I kindly apologized and I explained my situation to my family. And since then, I have been applying this approach and managing my time much better than before.
All right, just as good. So you start to work on that. You start to not to be angry very fast. We all have the same, but I mean, I think better to mention something not in your personality. Maybe people don't like that. So I'm always talking about I am detail oriented, but now I'm finishing tasks in the time. So maybe maybe better. I don't know. But your answer is good also. Um, Also, sometimes I mention what I don't like I'm doing. I'm not spending a lot of time with my friends because I'm always busy with work. I'm always busy with studying. So something I want to change to spend more time with friends, right? So I mean, mentioning things like you was angry, is working on that. Maybe people don't like to hire someone like this. So I mean, that is my approach.
Mhm.
So you can mention easily, I was before busy because I'm doing exams, I'm studying, I'm working.
Mhm.
So I wasn't spend more time with my friends, but now I can do more. I can meet with them more.
Mhm. Just reverse it,
Yeah.
Mhm.
So anyone has so let me ask, I will not mention one. I know most of you guys have good scores, but let's say if you ask someone of you guys why you have low scores, what you gonna answer? If someone has low scores.
I think that they should focus on something else that was taking up a lot of their time. So, for instance, if someone was focused on research, and they couldn't study all that well.
Yeah. But I mean, the question in this scenario, sometimes some applicants have like 210 in CK, 211, whatever. And they ask you why you didn't get good score in this exam. So most likely you can say, if you have someone who has sickness in your family or you have sickness during that time, you have to find a reason. I mean, only these questions you're gonna ask if you have this. If you don't have those scores, that's fine.
Doctor, can I ask you a question?
Yes, sure.
As you said, for example, if someone had encountered a family-related, for example, a family member got this diagnosis of a terminal disease, and this actually impacted my performance, for example, in my exam, and resulted in kind of a low score. I know sometimes I heard it that don't use this type of excuse because all people make their family sick or die because of to explain or to explain something, but it is actually true. So can I use it or I
You
should
can
avoid
mention
that?
like you're sick during this exam. It's fine. But also my approach in this type of questions, after mentioning that you got low score in CK, you can say, and I came back and I did step three and I did good score in it. So if you did step three after that and you did better score, so try also to switch it to something good you did after that. Like big research you did, step three score you did, step one passing or step one good scores. So I mean, like, try to convince him that you are good, but only in this exam you did good score because you were sick during that day.
All
You got
right,
it?
thank you.
You're welcome. So there is a question here. Can we circle back how to approach the answer of CV gap? So what I said in the gap, so try to mention what you did during that time. Yeah, I know you are not working as a medical physician, as a physician, but if you are doing research, mention that you're doing research. If you're doing tutoring, mention that you was doing tutoring. If you're studying, you mention that you were studying, but also studying not a real excuse. So try to find something else you was doing, something else in medicine, teaching, volunteer work, anything else. And my opinion, while you are writing the CV, don't mention any gaps. Try to fill all the gaps. So no one will ask you this question from the start. Uh, okay. So I think most of you guys IMGs. So if you are IMG, what makes you can compete with someone born and raised and get his education in the United States? So this question will go to Maha Qadur.
Actually, personally, I've raised in multiple countries and I've lived in multiple countries, in many countries with diverse community, and I got very flexible with dealing with diverse communities and diverse patients from different backgrounds, which made me realize that I can really work in the US like people who was raised and born in the US, because during my US clinical experiences I did that, and I was I'm not I was exposed to the patients from diverse communities, so I was able to communicate with them and I was able to give them what they want and to understand them in the back actually. Moreover, actually, I think I got good I would say I got a good medical training because I trained in my country. I also worked shadowing my parents who are both physicians in the UAE, and I also had a 4 month clinical experience in the US. So I think I can be as a student who was raised and born and get his training in the US.
Okay, this is great answer. Just you can make it a little bit shorter. So you can say like, IMGs and the AMGs, most of them has good scores, most of them has research. We also graduated from good medical schools in our home countries. So just maybe the difference is they did more USA clinical experience than us. But after starting residency, we all will be the same. And after getting even the board, we all will be the same. All right.
Okay, thank you.
You're welcome. So also this question everyone will get during the interview. I can ask Ishita why you choose internal medicine and why you choose to join medical school. So first thing,
So,
tell me why you choose to be a doctor first. After that, tell me why you are internal medicine physician.
uh, that's an interesting question. So I grew up watching my grandmother, who was a physician herself. She was an OBGYN, and she did post-graduation at a time where women in my country did not even complete school. So she was my inspiration. She uh, treated women in the community, taught them about contraception and menstrual hygiene, and her service to the community inspired me and my parents as well to pursue medicine. So that is why I went to med school. In med school, during my internship, I rotated in different specialties. I rotated in surgery, and I worked with really talented surgeons in my hospital. And what I noticed was that the patients would always go to the step down unit or be admitted in the internal medicine ward, and I could not form a relationship with them. I also rotated in family medicine, and though I enjoy the outpatient aspect of medical treatment, I felt that my passion actually lay in treating patients in the hospital setting, dealing with ICU patients, where I really learned a lot during my ICU rotations. And because of that, I chose internal medicine because that is the field where I feel most fulfilled.
All right, this is a great answer. Let me ask the same question. You are doing good. Muhammad Muhyiddin, tell me why you choose internal medicine.
Uh, Internal medicine offers something special, which is a long-term relation with the patient. I'd like to know my patient well. I'd like to follow up him, and I'd like to form the theories about what he is complaining of and what is his problem mainly. I'm not the man who can cut someone open and go away. That's not me. I'd like to dig deep about what he's complaining and what are the surrounding problems that might contribute to his illness. And I'd like to follow him up about a week ago and see what if he improved. That's what really interests me. And on a particular way, I'd like the intensive care unit and how it's dynamic and how we can make changes to people's life through a more comprehensive and multidisciplinary care. So that's why I like internal medicine.
Oh, this is great. That's a great answer. So just a little bit comments. First thing, Ishita, why you choose medicine? That is very good answer. Why you choose to be a medical doctor? Some other people say like, because my grandfather was sick, and I know that after I realized that medicine is very important. Or sometimes saying like, when he was walking in the street, he find a guy, he has anaphylactic shock just by the adrenaline, become good. I mean, like a lot of stories. So that is fine. Your answer is good, and the other answers also will be good. Also, medicine, you and Muhyiddin, he answered this very good also. So I don't have any comment on that. So let's go to the next one. Uh, Let me ask.
Excuse me, Dr. Ahmed, I have a question, please.
Yes, sure.
So for these questions, you said why internal medicine, and this question, we wrote that in the personal statement. Should we stick to the same answer in the personal
Sure.
statement?
Yeah, for sure. You shouldn't
Yeah,
change because you write in the personal statement you become a physician because of this,
yeah,
and you are saying to me now another thing. So
yeah.
someone else wrote to
Thank-
use the personal statement then.
Yeah,
Okay.
exactly. Thank you so much. Appreciate it.
You're welcome. Um, Let me ask this question. All right. So, BJ, are you here? No. So, El Gharabawi, are you here?
Yes.
Yes, great. So, what do you like about internal medicine and what you don't like?
Mm-hmm. First, what I'm like about internal medicine, I like the way we can handle people in different situations and in their difficulties, passing a difficult situation in their life, and that we can change life by doing research and doing some academic stuff even. Those things can help change people's life by a lot of things, by a lot of means. rather than doing some surgery or doing something which is specific. We can do a major change in people's life. And about what I don't like about internal medicine or medicine in general or internal medicine
Internal
specifically.
medicine. Internal medicine.
Okay, internal medicine. That something sometimes things go complex, and we can take time to reach diagnosis. And I feel that I'm not I'm in difficult situation with the patient, but we can handle this by staying sympathetic with patients and help them pass this difficult situation and pass this difficult period when we are looking forward to a diagnosis to them. So we can pass the situation by dealing with them in a sympathetic way and letting them know that we are dealing with in the best care of them.
Correct. I'm not agree 100% with your answers, but I'll also tell you my opinion, okay? So
Okay,
I can
right.
say what I like about medicine is that the communication. Most of medical patients will be with you in the clinic with you. So you are not working behind the computer like in radiology, for example. So I like the communication with the patient. I like to follow up with them for long period of time. Most of medicine conditions are chronic diseases like hypertension, like diabetes, and that's what I like about medicine. I like to be a friend with the patient. All right, that is the best answer.
Okay.
What I don't like about medicine, I can say like medicine is very challenging. I am dealing with multi-organ system, nephrology, GI, cardiology,
Okay.
lung, everything, and this will make the job very tough. So you have to understand the pathophysiology of every disease, and in this situation, you can miss some diagnoses because the rare diseases, if you are taking care of all these organ systems or all the systems in the
Okay.
body, so you may miss some rare diseases. Also, you can mention other things also you don't like, which is how to make, because most of your patients are chronic patients, how to make these chronic patients adherent to their medications. So that is a very tough job to do, and that this thing maybe I
Of
don't
course.
like about it. So a lot of stuff you can mention something you don't like, something you like, but also to be very clear to the person that hearing you that he's hearing the right thing.
Okay, and what's your opinion about saying that I have to deal with the patients when they are not or they are in a difficult situation like what I have said? This is a good
Yeah, that is good. That is good. But I mean, like,
uh,
this thing, I think it is you should like. Because if you don't like this, so
okay.
why you are going to work with this? Okay? Because
Okay.
most of your
Thank
cases will be like this. Right.
okay. Thank you.
Can I ask something?
Yeah, sure.
So can we say that what I don't like about medicine is sometimes we have to deal with patients who are aggressive and can be verbally abusive, like patients who are under the influence of a substance. So can you mention that as something I don't
You
like?
can, but I think this may be an answer for a psych resident. Like,
Okay.
if you are working in psychiatry, so most of your patients have like hallucinations, have water mania. So yeah, this thing no one like to deal with that. But in medicine, I think 99% of your patient, especially here in the United States, we don't find this. Maybe in our home countries it's a lot, but I mean like here we don't find this. So I don't think it will be legit. Like we find it a
Okay.
lot here. We
Because
don't find it
actually,
here.
during my rotation, I actually saw a patient. He wanted to leave against medical advice.
Yeah.
So he had like 10% ejection fraction. So the people were counseling him and he got
Happens.
really abusive. And so, yeah, I really didn't like it. That's why.
Happens, but I don't like. Usually, I'm advocating about this patient. You have to say that I advocate about this patient rights.
Mhm.
So if you mentioning that patient was abusive, this stuff, sometimes it will reflect on you. Okay?
Okay.
So I think avoid this with this
Okay.
answer. That's my opinion also. If
Doctor?
someone, if someone, by the way, if someone like his answer, it's fine. Sometimes I'm giving opinion, maybe it's not the right thing, but that is always will be my opinion.
Hello?
Yeah, sure.
Yeah, can I ask you something?
Yeah, you can ask.
Yeah, about why not internal medicine. Can we mention that uh, sometimes or most of the times in internal medicine, we are seeing the dead end in the diagnosis, and sometimes it makes you frustrated. And I don't, the feeling of dealing with this.
Yeah, you can mention that. You can mention that, especially if you are working in ICU setting.
At the same time, if I'm mentioning that why I like internal medicine, that I'm the kind of a person who likes to solve puzzles and all the complexities of the systems interconnected. And so
Yeah,
for
that is
not
right.
like in liking internal medicine, okay.
Yeah,
Sorry.
that is
Okay,
right.
thank you.
Both of them can work also.
Okay,
But
thank
as,
you.
but as I mentioned to you, Shita, like regarding the patient aggressiveness or something, not a lot here. Yeah, there's some patients with alcohol intoxication. Yeah, sometimes become like this, but not a lot. That is not very common here.
Okay, I'll mention something else.
Sorry.
Yes.
Just as my personal opinion, what if we coin the term hate into challenges in internal medicine just to be modest when we present it, like saying the challenges in internal medicine
Yeah,
are such
challenges.
a
It
huge.
challenges what you don't like about internal medicine. But I'm just asking these questions because most of these questions I got during my interviews while I was applying. So they were asking like this exactly. So most likely they're
Yeah.
gonna ask this kind of questions.
Okay.
Right, great.
Doctor, I have a question.
Yeah, sure.
So if I want to frame my answer as they're chronic patients, they're in underserved communities, they tend to be less adherent to their medication. Can I mention the American insurance system and sometimes how they can't afford their medication, or should I should I not never mention the
No, don't mention about the insurance thing. No, no. Sometimes most of the patient not adherent to medication, or most of the time actually, because they don't like to be on a medication like for a long time. Other patients have dementia, no one helping them at home to give them medications. So this thing maybe you can mention like you don't like.
Well, I shouldn't criticize the insurance
Yeah,
system
yeah, yeah. So my opinion, just if I answering this question. What I don't like is like some patient not adherent to the medication without mentioning any reason.
Yes,
Without
thank you.
mentioning any reason.
So, doctor, we don't have to back up our answer like we did for what is your weakness? When we mention what we don't like about internal medicine, do we have to like explain what's the like I would mention my point and then should I back it up in
So,
terms of
so in
yeah.
general, things that you like, try to talk for 10 minutes about it. Things that you don't like about the specialty you are applying for, talk about it in 10 seconds. Okay? So don't mention a lot because if you mention a lot of things, that means like you are gonna apply to internal medicine and you don't like internal medicine. So don't make him like mention it in very little way.
All right, thank you.
Right, great. So the next question, it will be to let me ask Mehdi. Yeah, you can answer this question. If you want to change something about internal medicine, what you gonna change?
That's me, Shahd.
Yes.
Yeah. If I were to change anything about internal medicine, I would make things more accessible. I would educate patients more. I would run more campaigns. I just would like to improve the communication between the physician and the patient instead of spending more time documenting and spending time on notes.
Yeah, that is good. That is good answer. Also, one more answer I can add also to this. Some people mention that now we are living in like there's social media, so we can use this to educate the patient about prevention of diseases. So prevention of disease will not make the patient coming to us after that have the disease itself. So this is also something you can add. But your answer is very good also. Uh, so let me ask the other question to which one? Uh, Mahmoud Rifai. So, Mahmoud, can you describe to me internal medicine in 3 words, if you are here? There is also Mahmoud Abdelati. If you want to describe medicine in 3 words, how you will describe it?
So thank you, Tahmid, for having me. Basically, I can describe internal medicine in number one, passion. Number two, lifelong journey of continuous learning. Number three, we are dealing with our patient like solving a puzzle.
Dealing with patient, again, can you repeat this again?
With dealing with our patient in diagnosis our patient like solving a puzzle.
Solving a puzzle. Okay. All right. So the way I was answering also this question is I was saying like I would say it is a challenging, it is thought provoking, it is exciting, whatever. Like a lot of words you can describe medicine, but also this kind of questions a lot of applicants can get during the interview. So let me go to the next one, and Toka is here. So if you are here, I would like to ask why you choose our program to apply to.
Mm, I choose the program because it is a good program. Is an education based. The training is great there, and it has great reviews from the attendings and the residents. It serves a diverse community, which will allow me to learn from a greater population.
Okay.
Which is actually what I'm seeking to be a greater physician in the future.
Yes. So the way also to answer this kind of question, my opinion, you can start the story from the start. Like, if you have, especially if you have connection in the program. So you can say, like, I heard about this program from my friend, his name, you can mention if he's a resident in the program, and if you're talking to him or her, whatever. And I heard a very good, outstanding information about the program, like the research and the clinical education and the didactics. You can talk also about the region of the program. Let's say like we are here in New York City, so the restaurants, the visiting or things you can do. So a lot of things you can mention. My opinion, if you have a connection in the program and you would like to mention his name or her name, that is good also. Like you can say, he told me about the program, this one, two, three, four, and I was, after that, I looked at the program in the website, so you can show interest by this way. And I read everything about the program, and I find that there's something interesting you wrote. Sometimes the program director in his word in the program website, he write a quote or something. So if you mention this to him, that means he will know that you read everything. Sometimes during my interviews, some program directors write a quote under their name, write something specific in their welcoming in their website. So I was reading it and I was mentioning this to them. They will like that.
Mm.
Right? Good. All right. I'm gonna answer all the questions in the chat after just we finish all of these questions that we have. But I'll answer everything. So let me ask this question to Arlisa. Arlisa. So the question for you is, what is unique about our program not present in other programs?
So I think I should tailor that to the program. Like I could mention their tier level, whether they're tier one, tier two. I could mention their research funding or their medical centers, particularly if they have a cancer institute that's nationally recognized or not. I don't know.
Right.
It depends very much on the program, right?
Depend on the program. You said it right. Okay, it depends on the program. So before starting for doing the interview, you have to read everything
Mhm.
and you have to prepare something for this question because most of program directors like to know what is present in my program, not present in others. All right? All right. Muhammad Muhi, you raised your hand. You can talk. You can.
Yes, I was wondering if I'm sending a letter of interest, should I send it to the program director or the program coordinator or both of them?
So my opinion, send it to the program director, dear doctor, and he's the program director. Just as the coordinator, make her as a CC,
Okay.
CC in the email. But the letter should direct it to the program director only.
Okay. Thank you.
Okay. So next question. So this question gonna go to Aisha. So during the rank order list, how you gonna arrange the programs? Sometimes they ask this kind of question during the interview. If she is not here, I can ask this question to Dua.
While we're waiting, I had a question
Right.
that is somewhat related to this as well. So, are they gonna know if we're dual applying? And if we are dual applying, what do we say when they ask the question you just asked us? Because if they know
So
we're
if you're
dual
applying
applying,
to
they know we're gonna.
two specialties, you mean, right?
Yes, exactly.
So most likely they're gonna know from your CV. If your
Yeah.
CV has like, pediatrics and medicine. So
There you go. Or
they're gonna feel
recommendation
that,
letter.
but they are not sure about that.
Mhm.
Also, if you apply to two specialties, you can mention, but I mean, like, don't mention until we will like stress you to answer this also.
All right, all right, all right.
Right?
And when they ask us how we rank the programs, how should we answer?
So how to rank the programs? I would say I'm ranking my programs according to the clinical education, research opportunities.
Nice.
Also, sometimes you can say, oh, okay, I have a family, I have friends there, so I'm gonna rank the programs that I have my family here better than others. Depending on the person himself. Everyone has separate answer for that.
I see. That's
For
not
me,
dependent on the specialty, I see.
yeah, but for me, because I don't have my family here, so I can say, according to the didactics, according to the research, I'm gonna arrange my rank order.
I see, I see, I see.
Uh, Next question. How you know about my program? So Ishita, for you, like how you know, from where you know about my program? That's just a question for you.
That's a tough question. So the true answer is that I know about your program from Residency Explorer, and I follow your social media profiles on Instagram and Facebook. I see how invested you are in physician wellness, and I see the different conferences your residents present their research at. I saw images of your simulation lab, which looked very interesting and made me really excited about your program. And I saw the didactic curriculum, which is very robust and draws me towards your program. So this would be the honest answer, but
Good answer. That is very good answer. So you can say I know about the program from Residency Explorer. You can say I have friends in the program. They told me about the program 1 year ago. They matched already in the program. So I heard about the program. After that, I started looking at it. I looked at the website. I looked at it in Frida and Residency Explorer. After that, I found the program page on social media. I followed it. So that is good answer. Right. So next question will be, who has here good research, like high number of publications? Can raise your hand. All right, you would answer. Okay, so Let me ask this question to anyone here, like Rabia Akram. Are you here?
Yes, I'm here.
Yeah, great. So let's imagine that you have high number of application. I don't know what you have, but let's imagine that you have a high number of application. And I'm saying, I find that in your CV that you have high number of applications. Do you find yourself in my program and we don't have big research institutions?
Sorry, you have mentioned that this program doesn't have
That we
a
don't have
research.
research. We don't have a big research, and you have big research profile. How you find yourself in my program?
Yeah, okay, that's a that's a very tricky question. So I would answer. I mean, I don't have a very vast, extensive research experience, but in that case, I would answer that I had the opportunity to spend my time in a more creative and learn something new. So I was drawn to the research work during my gap from the graduation to this time. But other than research work, I was drawn to your program due to because it is in my geographical preference. My family lives there, and I with all the support, so that would be very convenient for me. So that makes me honest here.
All right. So, uh, I would say yes, I have big research experience while I was working, let's say, at Mayo Clinic. Just I'm saying. And during that time, I learned how to lead a project from A to Z. So even if I come to your program and you don't have leadership for research, but I can lead a project by myself, and I can continue my scholarly activities even if the program don't have research because I can lead it. I don't need a mentor for that. All right. So that is a simple answer
All
for
right.
this. Like, you can say, like, you can lead the project itself.
Okay, so we can mention that we can bring something to your.
Yeah, you can bring it to your program, and also you can lead it because you have big
Right,
research.
right. All right.
Yes, that's what he's saying to you.
All right.
All right,
All right.
great.
Thank
So you just make the answer to him, like answer, make the choice for him after that. All right,
All
great.
right. All right.
Let me ask the next one. So this question will go to Rushdie. Are you here? So this question is, what is the most important three things you are looking for in your residency program? If he's not here, I can ask Sam after him. If Sam is here. Okay, library, okay. Suad, if she is here. Sultana.
Hi, I'm here. Could you
Yes,
please
good.
mention the question again, please?
So the question again is, what is the most important three things you are looking for in your residency program?
So my future goal is to be a compassionate internist. I want to be a hospitalist. And for that, I think more IB, the clinical skill will make me fit for that and will make me grow in this field. So I I want I think it's I will go. I have gone through your website and I saw it's a big hospital, and I will be able to get exposure to a lot of patients and new diseases that will help me to grow as a clinically skilled internist. And I want to learn under your supervision, and these things I think I'm looking for.
Okay, this is good answer. So in conclusion, you can say like I'm looking for good education, I'm looking for didactics, I'm looking for research, I'm looking for friendly environment. Very important to mention that you are looking for a very good environment to work in.
Environment.
Okay,
Okay.
all right.
And I have a question actually regarding this, if I can.
Yeah, sure.
So, if I get an interview from a community level hospital, so should I mention about research and
Not too much, not too much. Like, if you got interview from community hospital, you can mention a little bit, like I did research, but don't go in details because most likely you don't maybe understand like what you are saying,
Mhm.
right? So just focus more on the clinical aspect, not the research
And
aspect.
then I have another question, which is if they ask me the question, I don't know if the question is coming. If they ask me the question that what do you want, where do you want to see yourself in 5 years, 10 years, and 20 years?
So depending on if the program has in-house fellowships or not, like if they have in-house fellowships, I would like to say like I'm gonna apply for fellowship. If you want to apply for fellowship, if you don't want to apply for fellowship, okay, say most likely I'll be a hospitalist. Most likely, also I want to teach students, whatever. Like depending on everyone has separate answer, but also depending on the program you get interview from. If the program
Yeah,
has
for the
fellowships
community
or not.
level based
Community
hospital.
levels, you don't have fellowships. Okay, so you can say, I didn't decide yet. I'm the person that have to wait until I try cardiology, GI, all subspecialties. After that, I can decide. So you can make it vague.
Mm,
You are not in pressure to answer the question the accurate way. Because even me, while I was doing applying, I was in doubt if should apply to fellowship or not.
mhm.
All right.
Yeah. Yeah. Thank you.
You are welcome. And there's a question here. If the program director email not mentioned in the program website, where can I find it? So you can Google it. Most of the program director emails are present on Google. You can ask some of the residents if you have friends in the programs, they can send you the email. All right. Next question. Uh, so sometimes they ask you, what do you like about the city that the program present in? So, who is answering this one? Yazan, if you are here, what do you like about the city that the program present in? How you answer this question?
So I asked a friend who is already in your programs, and he told me about the weather. The weather in like Michigan, most of the time it's like sunny. It may like 2 or 3 months maybe cold, but most of the time it's very cool. Uh, so also I have some of my family in this area, so I would love to stay with them. So that's why I choose this your program and also this city exactly to stay inside it.
Okay, good. So, in general, to answer this question, first thing you have to Google the city before the interview. Let's say I'm in here in New York. Okay, so do Google, and better to say I have visited the city if you did. So if you did, mention that you visited the city and you visited the areas like let's say here in New York, Empire State Building, State of Liberty, whatever. Like a lot of things you can do in New York. So you can say I visited 1, 2, 3, 4. I like it, the restaurants. I like it, whatever. Like a lot of things you can like about every city. So the clue for this question is try to open Google Maps before the interview and look exactly what is present in this area, right?
So okay, doctor. So it's like a new program in rural area.
Yeah.
There is not like something special about this area. Is there any answer that we like should use it or
You have
it's okay?
friends in this area, you have family in this area. You can mention
Even,
something else.
but even if I don't have like doctor, maybe like mentioning some like my aunt there, my uncle right there, it's okay, right?
Yeah. But also there's something else. Like, even rural areas, you can do hiking there. A lot of things. A lot of
Mhm.
things. Like, even it is rural, but I mean,
Like forest,
knowing it,
like yeah, trees.
especially here in America, if you opened even small cities, you can find right like things to do in San Francisco. It is big city, but let's say
Mhm.
small city, right? Things to do in Albany, for example,
Mhm.
New York. So they will tell you something to do.
Mhm.
So Google will answer you.
Okay, thank you, doctor.
You're welcome. Muhammad Muhi, he raised his hand.
Okay. Can I say something like
Yes.
the Muslim community in Michigan is a little bit large, so I can feel like I'm home and connected to a lot of people with the same religion.
Okay, but if the program director is a Muslim, okay, we understand this the wrong way. So for me, I'm just being neutral during the whole interview.
Okay.
I'm not mentioning anything about religion
Okay.
because sometimes you don't know who you are interviewing with. You don't know if you like you or not. You don't know if you like your religion. I don't know. Right?
Okay.
So just try to be neutral. You can say like Arab community more. Okay, that's fine.
Mm-hmm.
Or the people that speak your language more. That is better.
Mm-hmm.
Make it this way.
Okay.
So the next question is, our program serve huge number of people, like programs present in New York City. Do you think you can handle the staff workload? So this question will go to Chikaudili Erika Odu. I'm sorry if I didn't pronounce your name right.
That's okay. Sorry, can you repeat the question?
So the question again is, our program serve huge number of people. Do you think you can handle the staff workload?
Absolutely. Because coming from my home country, I work in a very diverse community, and my hospital is the busiest. We serve millions, and I see a lot of different pathologists in my hospital where I work currently. So I'll be able to provide care for this very diverse community and with the very much workload.
Okay, that is great. Also, I was answering this kind of questions like I was working in Egypt, I was studying also USMLE exams, I was doing this and that. So I'm working at least 16 hours per day while I was in Egypt, so I can handle that.
Okay, all right, thank you.
You're welcome. So let me ask this question to Dua Abdul Karim. The question is, what is more important to you, clinical experience or research? If she is not here, Ilham is here.
Yeah, I'm there.
Okay, what is more important to you, clinical experience or research?
I think it would depend on the program. So if it's like a community hospital, I would say clinical work. I'm actually more interested in clinical work. I want to do like more clinical work and work with communities in general. I would like to do some research as well, but like my priority will go into clinical work.
Okay, that is great. So even, by the way, even if it is a university program, the answer should be clinical. So clinical work is more better than research. But still you can say like, however, I can do both. However, I can do both.
Okay, thank you.
So let me go to, again, Aliriza. So the question for you now is, what is your future goals?
I think this also depends on the type of program, whether they typically will graduate academic internists versus, well, private or something. But I think it would be safe to just say I plan to stay in academia or like work as an internist. Or if you plan to sub-specialize, you could say just plan to sub-specialize in whatever field, right?
Yeah, that is right. That is right. So depending on the program, if the program have in-house fellowship, so you can say like, I'm planning to do this kind of fellowship. If you want to do for sure. Also, don't forget to mention tutoring if you are going to give lectures, because most of the residents, even me, trying to do some lectures during the rounds or after the rounds to teach students, to teach your intern. So we have to do that. So you have to
I
like
have another question here.
it's about teaching. Yeah.
So like
You
I
can
asked before, if you are if you're dual applying or something. Now, here when they ask what do you plan to do after, Could you say I plan to do the internal medicine and then do my second specialty of interest?
Yes, you can mention that.
We can, for example, can we say I plan to do internal medicine and then ophthalmology, for example?
Ophthalmology?
Ophthalmology or dermatology or whatever.
No, that is another
That's what I'm saying. Like,
residency.
so that's not going to
Another
be all right. Okay, good.
No. I'm saying a subspecialty of medicine, like cardiology, GI, this stuff.
So don't mention any second specialties. Got it.
Sure, for sure. If you wanna go to dermatology, why you are applying to me?
Got it.
Okay. Okay, good. Um, so as we said before also, if you're saying are you gonna apply for fellowship or not, so depending on the program, all right? Will be next question. So sometimes they see that from your CV that you are gonna apply for fellowship, and they are saying like, we don't have in-house fellowship. How are you gonna do that? So Ishita can answer this question. So again, I'll tell you the question. As you know, we don't have in-house fellowship, and seems to be you are going to apply to a fellowship. Do you think our program will match with your future goals?
Thank you for that question. I know that your program does not have in-house fellowship, but I have researched your program and I'm interested in pulmonary critical care, and your program has a very robust ICU system where I think I will be very well trained in critical care, which will help me match in a very good pulmonary critical fellowship in the future. Moreover, since I have family in this area, I would actually want to come back to this area and serve the community even after doing fellowship. And that is why I want to do my residency in this program, because I have a support system here, something like that.
Okay. So my opinion also, if they don't have in-house fellowships and they asking you why you are gonna apply for fellowship or what you're gonna do, so you can say also, I'm doing already before I did research, like say in Balmicret, and I still have my connections in other places that will help me to get the fellowship. So the thing is now to get a fellowship, we have to do medicine first. So that is the thing. The other thing also you can say during even my residency, I'm gonna continue research because I can lead a project by myself. Right? Great. So
Hi, can you please repeat that answer about not having in-house fellowships?
So if they don't have in-house fellowships and and you seems to be going to apply for fellowship, like me, I was applying to GI and we don't have GI in my hospital. So I got this question and I just the answer was I did research in GI in Mayo Clinic and now I can lead a project in GI. So also I can do outside electives. Your program allow me to do 1 or 2 months during my residency outside electives. So easily I can do some connections in the programs that have in-house fellowships in the future to get a fellowship because I'm telling them like, the fellowship match depending on other things. So depending on the research, depending on the connections, depending on the step scores, and all of this I can do even if I'm matched in your program. All right?
All right, thank you.
You're welcome. So next question will be to Jonathan, are you here?
Yeah, I'm here.
Okay, so it is a couple questions. First thing, do you like teaching? If you said yes, the question is, if I asked you to teach me something not in medicine, what you gonna teach me?
Okay, yeah. So my answer to the first question is yeah, I love teaching actually. So during my medical school, I was a president of this extracurricular organization, which was a medical student association. So it has a standing committee in it, which was dedicated for medical education. So as a president of that standing committee, I organized different seminars for our junior students who had difficulties with some 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 some
So,
topics.
can I
So
stop you on this point? So the
uh,
question wasn't like this. The question was, teach me something not in medicine. Teach me something not in medicine.
okay, I just wanted to touch a background on why I love
Yeah, teaching.
education,
Okay.
but okay. So um, can you give me a hint on how I can answer
All
that?
right.
It's
All
kind
right.
of
All right. All
tricky, you
right.
know?
So usually if
Can
I
I
tell you
answer
like
this question?
who want to answer?
Maha.
Okay, you can answer.
So personally, yeah, I like teaching and I have experience with physiology teaching. But if I want to teach you how to do one things outside medicine, I would really like to teach you how to make the best cheesecake or tiramisu, since I can say I really like doing them, and I mentioned that in my hobbies. So I can teach you that.
Okay, great. So that is an answer. Also, sports, you can ask any sport, any hobbies, all of this stuff outside of medicine. So any games, even if you are playing games, anything like playing chess. If you don't know how to play chess, if you don't know like any sports, you can teach him about or any food cuisines, this stuff. All right. Because this type of questions, just they ask this kind of questions to open a conversation with you. Okay, so next question will be
So
for
sorry.
yes, you're fine.
So about this thing, should I continue on how I'll be able to teach them, like in detail, or just tell them what I want to teach
Yeah,
them?
no, just a second. If you're gonna tell something, you have to know exactly what you're talking about. Like if you're gonna tell, like I'm gonna teach you how to do cheesecake, as she said, so you have to know exactly how to do that. And what is the component, how to do everything. So I'm asking this kind of questions so you can prepare for the interview now. You know,
Oh yeah.
no, there's a question, so you can prepare something in your mind. So if you got this question during the interview, you don't have to think, you already have the answer.
Okay.
All right, great.
Thank you.
Uh, Um, Shah, she is saying, I think the question is about hobbies. So sometimes it is like, what is your hobbies? But sometimes it's like, teach me something not present in your CV, teach me, or something you're gonna teach me. So if she said some of her cuisines, she can cook something, so that's fine. She can teach that. So this question gonna go to Suad if she is here. What is your ideal future job? Or I can ask this question to Ragd if she's here.
Yes, doctor.
Yes.
So,
What is your ideal future job?
well, I can imagine or I can picture my ideal future job to be definitely in internal medicine. I'm still deciding whether I would prefer to be a hospitalist or to subspecialize in one of the major subspecialties in medicine. However, definitely um, being part of the primary care as
Right.
an internist is an important element in
All
my
right.
perspective.
Right. That is a good answer, but also try to mention about the work environment. By the way, 50% of our work is environment. You can like primary care, you can like hospitalist, you can like whatever you like, but try to mention I'd like or my ideal job to work in a very good work environment, not toxic environment. Right? I can ask the next question to Barvender Kaur. So the question is, why you want to do research after starting the residency? Okay, maybe she's here, not here. So this question will go to Tudor. If Tudor, Todor, if he's here. Maha can answer this question. She is here. Jose, if you are here.
Sorry, what was the question?
So the question is, why you want to do research after starting the residency?
Okay, so I'm interested in cardiology. It's not 100% sure that I'm gonna do that I'm gonna pursue this fellowship. Maybe I stay as a hospitalist. However, I'm targeting my path to go to there. So if I want to do a competitive fellowship as cardiology, I think research is a really strong point for my CV. And also just because I enjoy research, I have a little bit of a background in research. I just joined right now, as you did, Mayo Clinic. I have like 2 weeks here in Rochester, and I'm trying to develop myself in this field a lot more. So yeah, that's the reasons why.
All right, this is a great answer. You can add also one more thing, which is any guidelines come depending on research. So research is very important for the patient and for choosing medications for the patient even in the future, right? The
Yeah,
next
cool. Thank
question,
you.
yeah, you're welcome. The next question for Abdullah Ahmed. Are you here?
Yes, here, doctor.
Yeah, great. So the question for you now is like, God forbid, it will not happen, but let's say, what you are going to do if you didn't match this year? What is your backup plan?
So I hope that I match this year, but God forbid if that happened. As I'm a resident here, I'll use this year to get an extra experience in internal medicine as I'm an internal medicine resident. Maybe this will raise my autonomy and decision-making skills. Moreover, I will work on some research projects in order to enhance my scholarity achievements. Also, I might apply for ACLS and BLS courses as well.
All right. Do you have a step three or not?
No.
So you
So
can
yeah,
mention
maybe.
also I'll do step three. You can mention
Yep.
also I'll do more research for publication. You can mention also I'm doing more months of US clinical experience. You can mention also I'm planning to get more strong letter of recommendations. I increase my connections. All of the stuff you can mention.
Yeah, absolutely.
Okay, great, great. So this question for Ishita will be why you want to practice medicine in United States? Why not in another country?
Well, I
Okay.
always wanted to come to the United States because I was enamored by the Western civilization and what I saw growing up on TV. However, as I matured, my desire to come to the US, it got shaped by medicine and how advanced the healthcare system is in the US, how there is a lot of focus on evidence-based protocols and preventive medicine. And I want to learn these latest guidelines and experience how medicine is practiced in the US and also give back the same practices to my home country in order to bring about improvement in overall global health.
Okay, that is a great answer. So the most important thing regarding this question, try to mention something good about US and try not to mention anything bad about your home country. Okay, that is the whole thing regarding this question. Um,
Doctor, I
so
have
yeah,
regarding this question, do we mention that we want to go back to our home country, or that's a no-no?
no,
Because
don't
I
mention
read
you want to go back. Don't mention
that.
you're gonna go back, because you're just coming. So you shouldn't mention that. So I can ask you this question now. Where you will find yourself in 5 years? Where you gonna find yourself in 10 years?
Asking me that question?
Yes.
I can't know for sure what's going to happen in the future, but I'm hopeful to finish my residency, lead educational projects, and do more research. I'm planning on staying in the same state and hopefully starting a family in the same state.
Okay, great. So that is the thing. So in 5 years, most likely you're gonna be a hospitalist, or you're gonna be in a fellowship. In 10 years, you're gonna be in a academia, teaching, all of things that you mentioned. That's good. Uh, so this question gonna go to let's see, who's here? Iman Makki, are you here?
Yep.
Okay, great. So the question now for you, what are you going to add to medicine? It is a tricky question.
What am I going to add to medicine? So first off, um, uh, I think that what I'm going to add to medicine, uh, so I want to contribute to the growing body of research that is present right now, in order to improve the care that we provide to patients. I'd also like to um, provide, I mean, a more empathetic aspect to medical care. Um, I'd like to be one of the many physicians that truly care about the patients, and take their time with them, really work on properly developing myself as a physician in order to deliver the best care that I can possibly deliver.
Okay, great. This is a very good answer. So this answer should be in a research wise, what you're gonna do, clinical wise, what you're gonna do. For me, I'm gonna add something else also, which is maybe social media. I can use social media to prevent diseases, to talk about diseases to patients, so patients can get some education about this. So that's what I'm gonna add. Um, Next one will be for Nihal Sayed, if she is here. Um,
Yes, doctor, I'm here.
all right. So the question is, sometimes they ask this question, what is the last book you were reading?
Last cook?
Yes. And tell me
Uh,
about it.
yes. Uh, Actually, I cooked the dessert, the tiger cake. I did
No,
it.
the last book you were reading. Book.
Book, not cook.
No,
I
book.
listened to book.
Mm.
So it not actually book. I'm listening to podcasts.
Mm.
So last podcast I listened about time management. It's called uh it's called Art of Management.
Mm.
So I would like to learn more. I can how I can manage my time, how I set my goals, and how I can work on my goals. These things I am very interested in how to
Okay,
manage
that
my
is a
time.
good answer. So when you first thing you have to prepare a book you was reading, you have to prepare who or the podcast whatever who is doing that. So mention the name.
Yes,
So
he
mentioning the name makes me feel like okay, you are doing
he's called
this.
Dr. Ihab Fikri. Yes.
Yes, yes, okay, good. And you have to know something about what they are doing, like what they are writing in the book or in the podcast. So this kind of question sometimes they ask. Um, okay, so next
Can I
question will be,
mention a novel? Can I
yes,
mention
sure, you can
one of
mention a
its
novel,
work?
yeah, for sure, yeah.
Okay.
But also my opinion, let's say before I am starting the interview, I know that I'm gonna interview someone has a Greek background, who have German background, or he's originally from India, he's originally from this. So sometimes I try to find something, maybe he know about it. So that is a little bit smart way to handle this kind of questions. Let's say, like, tell me what is the last movie you were watching, For me, because I'm Arabian, I can say like Arabian movies. But if he is from America and he's American, he will not know anything about this. So I have to put in my mind some American movies. So if I mention that, so I can open a conversation with him. You got my point?
Right. Okay.
Okay, great. Also regarding also the same thing, songs. Tell me about the last song you're listening to, depending on who you are interviewing with. If he is from here, so most likely they listen to English music, so try to mention something like that. Also, the thing regarding also the meals, they will ask you like, what kind of meal do you like? So let's say he is uh, from this country and you know some food about this country, so you can mention something that he likes. For sure he's eating this, so you can mention something to be to just to be more cultural. They want to hire someone can eat everything, can eat Pakistani food, Indian food, Arab food, Mediterranean food, American food, anything.
So, doctor,
So yeah,
if I don't have any idea about songs or movies,
you should
so
have one. You should have one.
I
Whatever.
should
Yeah.
I should read more
Even if
about
you are not listening to music, you have to listen. I don't know. I mean, like, one or two music, it's fine, but just listen to it before this. You have
it.
time now. You have like 1 month, so you can prepare all of these things.
I can know this from reading about the program directors more and his
Yeah,
history.
that is the thing. That is the thing. That's what I'm saying. Let's say you are gonna tomorrow meet with this person and they told you like the name of him. So you can just take 1 hour of your time to search him.
Search.
All
Thank
right.
you, Dr. Ahmed.
Ishita, want to ask a question?
Yeah, so if you have a background like as a professional singer, will they ask you to sing in the interview?
No, no, no. I don't find anyone unless you are saying I wanna sing. That's another story. But if you are a singer, if you can sing and you write in your hobbies that you can sing, maybe someone will tell you, okay, tell me a song. Okay, that's another thing.
Yeah, I mean, in my case, if somebody does ask me to sing, it'll actually help me because it'll make me memorable. But so I just wanted to ask in case I need to prepare something.
Yeah, yeah, you should. If you can sing, you should prepare something. Especially if you wrote this in your CV that your hobbies is to sing.
Yeah, I did.
Okay, so maybe someone will ask you like, tell us a song. Okay,
Oh.
it's fine. Um, Let me go to the next question. So let me ask this question to Muhammad Muhi. He already raising his hand. Okay, you can ask your question first.
Okay, I was asking about what should I wear during the interview?
Suit like this and the tie and everything.
Okay,
You have to be like wearing a suit and a tie and everything.
okay.
So the question now for you, if you have a ticket or a free ticket to go to a city, where are you gonna go?
Chicago.
So that is not the right answer. Okay. Why is that? Why is that? Because let's say I'm in New York and my program in New York. I want to come to New York. Try to sell yourself.
Okay.
Depending on the program area, like, if the program in California, okay, I'd like to visit California.
Okay.
That's what I am thinking like this.
Sure, for sure.
Okay, so let's ask the next one. So this question gonna go to, I don't know, Rabia Akram is here. Rushdie is here. Any one of you guys?
Yeah, I'm here.
Okay, good. So the question is, tell me a funny thing that happened to you during medical school.
That's a very good question. I'll think about it.
Okay, so if anyone have an answer? I can tell my answer, but anyone have an answer?
No.
Okay,
I'm thinking about it. Can you please give me a hint?
yeah, sure. I give you some time to think about it.
Sorry, you go ahead. I have
Okay,
no
I'll go
idea.
ahead. I'll go ahead. So, the way I was answering this question is, so I was telling while I was in my intern year, I was learning how to do stitches during the surgical rounds. So, the patient came, he needed two stitches, and the patient was very afraid about that. So the patient told me like, doctor, this is my first time in my life to get stitches. So I told him also that is my first time to do stitches also to you. So the patient ran away. Nothing like, it is a little bit funny, but he gonna like it. That's what happened exactly with me because it's first time I do stitches. So the patient also first time to get the stitches. So uh, it was a little bit funny.
Oh, that's funny. That's great. Yeah. Thank you.
Okay. So I mean, like, try to think about something funny happened to you during medical school, because this kind of question sometimes the program directors want to open a conversation with the applicant.
I mean, it can be out of some clinical interaction,
Yeah,
out
clinical
of
interaction,
with
but
your friends.
also don't harm a patient. That is the thing.
Yeah,
If you're
anything
mentioning
with your
something,
friends or
yeah, with your friends is fine also.
all right. Thank you.
So, question now for Yazan. Are you here?
Yes, doctor.
Yes, great. So, are you practicing any sports? And tell me a little bit about it.
So yeah, actually, I'm practicing swimming with my uh, with my relatives. Sometimes we go to a neighbor swimming pool. So also starting from my early life, I like swimming, and I also take the champion for competition under 18 years, under the competition for the under 18 years old. So sometimes also I go to the gym. I like to also running in the garden or in the park. So yeah, that's it.
Okay, great. That's fine. So the trick regarding this question is don't mention anything you don't do and say you are doing because maybe someone of the interviewing you, he know a lot about this sport or something, so he's gonna ask you a little bit more. Especially regarding the gym, like if someone going to the gym, I can see from his appearance.
Yeah.
If you are saying
Yeah.
I'm going to the gym and I can see you, okay, so I can know the answer.
Yeah.
Right? Great.
Yeah.
Uh, Let me ask the next question. So this question gonna go to Brivender Kaur, if she is here. Or Masuma Zainab Bukhari, if she's here. Mahmoud Rifai, if he's here. Mahmoud Abdelati, if he's here. Okay. Shahd Madi, she is here.
Yes. Hi.
Yes. Okay, great. So, yeah, the question is, what do you think about social media? Do you think it is positive or negative thing in the modern world?
I think this is an important question in this day and age. I think it depends on how you use it because if you go on TikTok, for example, there's a lot of misinformation, there's a lot of uncertified doctors, and if you go to, it depends on which area you visit online. And then there are some doctors who make good YouTube videos, they help other physicians, they educate the public. So it depends on where you look. So I think it's important to filter or look or know where to look from a specific lens.
Okay, that is a correct answer. So the thing is, like, social media can help in spreading of medical information, medical education, and meanwhile, it can help also to spread rumors. So this and that,
Yes. Okay.
depending on how you use it. Okay. So let me start with you guys the behavioral questions, okay? Because that is the most challenging part during the interview. So let me ask the first question. Tell me positive interaction that happened between you and a resident or attending physician or medical student or a patient. So usually they ask this kind of question if there is positive interaction happening between you and all of the hospital staff. Let me ask this question to Alariza if you have an answer.
I'm sorry, could you repeat the question again?
So tell me a positive interaction happened between you and a medical student, between you and a resident, between you and attending physician, between you and a patient.
Right. So I can mention the interactions that I had with the research fellows that they were doing their gap year. I could say that I worked with them very well. We got along very well. They were very focused, and every project had a good deadline. We could work well together, and we completed a bunch of projects. I could say that. And for the residents, I could say I did a few rounds with them, and I liked how they approached the patients. They prepared descriptions to give to the attending, and overall, it was a very positive experience for me to be with the chief residents.
All right, great. And with a patient.
Oh, positive with a patient. Yes. So, as an observer, we didn't get a lot of chance to interact directly with patients, but the interactions that I had with them were mainly focused on them asking questions on how they could improve or how they could prevent their condition from getting worse or coming back again, which my understanding was they were all very educated and they were all looking for answers. They were not looking to just discuss something. They were looking to get better and find answers to their problems.
Okay, that is great. That is great. So this kind of question, especially positive interaction, usually they ask this question. Um, Also, they can ask this question by the other way. Tell me a negative interaction happened between you and a resident or an attending, a medical student, patient. So my approach to this kind of question is tell the story, but also don't say anything that harming a patient, right? Like between you and the resident, maybe you came late, okay? You came late one day because there is a traffic and you apologize it to the resident, and after that you learn the lesson that you have to wake up early every day, so even if traffic happened you have to be at least half an hour before starting the work, something like that, so you are not harming a patient. Also, between you and the patient you can say one patient went to do a blood work, and the patient asked the nurse to about the results. So the nurse called me, and I was doing an admission at the time, or there is a blue code that time. So I was very busy. I couldn't return back to the patient to talk with him about the test results. So the patient was a little bit angry about that. But I went to the patient after that, and I apologized about the mistake I did. So the way you're gonna approach this kind of questions, it is a communication problems, not a mistake that you did with the patient, like prescribed a wrong medicine or this kind of stuff. Okay. This question will go to Ishita. Tell me a clinical situation where you find your ethics were challenged.
Where my ethics were challenged.
Yes.
So could it be in my home country, or it has to be in the
Home country,
US?
yeah, home country for sure. If you have experience, you can tell about your home country.
Um, it is. I don't know how to answer this question. I am not prepared for it.
No problem. That's what we are doing this session. Okay. So, yeah, you can answer this question if you have an answer.
No, can we repeat the question?
Okay. So the question is, tell me tell me a clinical situation where you find your ethics were challenged.
Can I say something?
Yeah, you can.
Okay. Once upon a time, while I was in the ICU, and I know some patient who is in metastatic cancer, and he asked me if something happened, he doesn't want a DNR. And in Egypt, it's not allowed to give anyone that type of code because we don't have a DNR code. Uh, so the situation was a little bit confused for me and for the faculty, that the patient insisted that if something happened, he doesn't want a DNR. And it ended up, fortunately, that he wanted to be transferred to another facility. So that was a challenge for me, that this is the patient autonomy, and this is the legislation in my country.
Yeah, this is good answer. Uh, so as a foreign program director, you're gonna know some idea about the ethics present in your country. So that is good. You're teaching them something new. Also, you can add about the telling a patient about serious diagnosis. That's also can be an ethics, especially if there is part of the family present. So you have to ask the patient first if you want your family to be present beside you while I'm telling your serious diagnosis or not. Part of the ethics. Others saying also you can mention um, uh, is the deny dinar. That's what we said. If the patient wanna be deny dinar or deny only or whatever, like this kind of happens. If you have, especially if you have a previous work in ICU. But the way I was preparing this kind of question is telling a patient about his serious diagnosis, and some of the family was present around. And do you want your family to be here or not? So this is an ethics, and it was a question for me. I shouldn't reveal any patient information unless the patient allow me to do that. I think Nagam was wanting to say something. She was raising her hand.
كيفك دكتور؟ شو أخبارك؟ أنا بس حبيت أسلم عليك. أنا نغم من كاليفورنيا.
In English, please. Yeah. How are you doing? How are you doing?
Good. بس حبيت أسلم عليك، ما عندي إشي.
Okay, that's fine.
I want, sorry.
Yes. Yeah, you
Um,
can ask.
Can I ask this question really quick? So, can we say in terms of ethics, for example, a patient asked for a sick leave, and then it was not indicated in his or her case,
Yes,
and the way
correct.
we handle, yeah.
And the way that you handle it, you couldn't give the patient sick leave because the patient is healthy. He does not have a disease. This is a good answer also. All right, great.
Could I add something?
Yes, sure.
Okay, we can say about something about financial compensation from the pharmacy companies, like for describing a medication in the health unit
Yes,
for the
correct.
company, yeah.
Correct. And even by the way,
Okay.
even the companies sometimes give you a gift. Okay, you refuse the
Okay,
gift
yeah.
because getting a gift from a company, it is not ethical. Yeah, a lot of situations you can think about it. That's right.
I have one situation which is like very common in my country, but I don't know if I can talk about it. So, there is something called like sex determination before birth. So, in my country, there is like a lot of people want to determine if the baby is female or male and only have a male child and abort a female child. So, I have actually faced a situation where in my internship, a family wanted to know the sex of the child, and
If it is a
it
female, they will go abortion.
yeah, it's illegal in my country to get it done, but people still do it, like illegally do it. So yeah, it was a difficult situation for me because I had to counsel them, and then I had to report them to my attending, and then obviously they
Let me
turned
tell
them.
you something. I understand the situation now, but I'll tell you something. You are honest about this, but not everything happens we should tell. Okay? Because this will appear bad about the country itself,
I
about
know,
what you
that's
where you're
why.
coming from. So my opinion, even I'm surprised about what they are doing, but my opinion, don't mention something that makes your country appear, not that, that is the thing. All right. But we have now four examples at least, so you can use one of them. which is fine. So the next question, tell me about situation you worked under pressure and how you handled it. So this question will go to Nihal Sayed, if she's here.
Yes, doctor, I'm here.
Yes. So tell me about situation you worked under pressure and how you handled it.
It must be in work, or can I say personal something, or
No, work for sure.
work? Because I have a situation when I came to United States, where I was raising two children and I was studying for US exams and I was continuing my research.
Okay.
So I was working under pressure, but this experience taught me how to work under pressure and how I can stay calm and organize it. So this is a situation that I can mention.
Yeah, that's fine. I mean, like you have children, you studying, doing research, that's stuff for sure. Maha, want to say something else?
Yeah, actually, I want to answer this question if it's okay.
Yeah, sure.
Yeah, so personally, I have an experience after the earthquake that happened back in 2023 in Syria and Turkey. I volunteered to help to help the affected people there, and it was really there was a lot of pressure there. I was doing some checking on patients first and categorizing them based on their severity, and at the same time we were fearing of comeback earthquakes, and this experience taught me a lot how to be calm under pressure, how to categorize my priorities, and how to interact effectively with other parts of the team actually.
Okay, that is good also. That the situation happened in Syria and also happened in Turkey, so you can mention that. Also for me, you just said the tough part, which what happened. You can also continue in saying how to handle it. Sometimes you can say, I'm going to the gym, I'm going for a walk, I'm going to do something, so you make yourself feeling better after hard night of admission or something. For me, I was saying like, sometimes while I was working, I was doing a lot of admissions at night. So the next day I have to do something else. I have to go to go to the gym. I have to go to for a walk. I have to like find something a little bit fun so you can still in a good way. Um, okay. So the question is, tell me about a situation you were disappointed. So this question will go to um, Chirich, if she's here, or Chikadili, if she's here.
Okay.
Yes.
I'm here.
Okay. So the question is again, tell me about a situation you were disappointed.
Um, so thinking about this question, I would speak to it from an experience that occurred during my medical training. So that was my first rotation in internal medicine, and we had a patient who came in. She had some social issues which were not properly attended to, and I know I reached out to my attending and asked if I could take up on the patient management and advocate for her to the hospital management to have her needs met. But I was told that since I was a medical student, that I couldn't go that far and I wouldn't be able to do. So for me, I was willing to go the extra mile and advocate for this patient, but I was disappointed that because of my position, I couldn't do that for the patient.
Okay, this is a good answer. Anyone want to answer this one? Rabia, I think.
Yeah, actually, I have a question about the previous question
Okay.
about working under pressure. Can you mention about a certain situation with the patient, like due to a miscommunication, an attendant with the patient was yelling at you, and then you learned to stay under calm. I didn't lose my calm. I communicated with him, and I solved the situation while staying under pressure? Or do I need to mention an example when while I was working as a medical officer in my home country, I triaged the patient during the dengue season with a lot of workload. So
Yeah,
which
yeah. Workload is better than dealing with angry patient.
okay.
All right. So even the situations that you were disappointed, I can say like, easy answer for this, which is we all did USMLE exams. I know we all passed the exams from the first time, but you can mention about your first NBME, you failed it, which is fine. You can fail first NBME. After that, you start studying again and you passed it. So you were disappointed in the beginning. After that, you started to study more to pass the real exam.
I'm sorry.
Yes, sure.
Yeah, I
Sorry.
just want to add. Oh, sorry.
Yeah,
You
no,
go ahead. It's fine.
yeah.
Thank you. I actually I failed my first attempt on step
Yeah.
one. Can I talk about that in the situation? I got
Yeah,
disappointed
sure.
because
Yeah, you got disappointed, and after that, you did the exam
I
again, you
learned.
passed it.
Yeah, I learned from.
Yeah,
Okay.
that's fine. That's fine. That means you
Okay.
are understand. But I mean, like,
Mm,
the ones that
fair
interviewing
enough.
you, maybe he didn't read that. Okay, so don't
Okay.
remind him about this. Okay.
Okay. Thank you.
Uh, so
Sorry.
yeah.
I'm sorry. Am I supposed to be mentioning like personal disappointments or just general disappointments and something that happened around me? Just to
Focus
not
more in medicine, actually. I think it
more
is better
in
to be more in medicine.
medicine.
Yeah.
So maybe if like there's a patient that had like a very poor social, state because of maybe his caretakers are not taking care of him that well, and it made me think about, um I don't know, but improving access to healthcare. Is that valid?
Maybe this is valid, but I prefer more to talk about my first NABME, which the exam I failed. Easy
Mm-hmm.
to and at the end of the day you pass the USMLE exams, so no one will judge you or anything.
Okay.
Because try to make sure that this type of question, the behavioral things, it is very tricky, and just they want to take from you only one word to just rule you out from the match. Okay, so try to be in the safe side always.
Got it.
So, Doctor,
Uh,
can we talk about patients in the oncology rotation, for example, our first patient sent to the hospice care?
so what is the situation exactly?
I was disappointed by how the patient was sent to hospice care so fast without being able to get treatment because he was in severe situation.
Yeah, you can mention that, but it was in your home country, right?
No, in the US.
In US. So the patient couldn't get treatment because he is in hospice care. So
No, because his situation was so severe, so he was sent to hospice care. So I can say I was disappointed by.
disappointed because we didn't reach to the diagnosis early, maybe. Maybe.
Yeah, yeah.
Yeah, I understand this. Okay, that's fine also.
Okay.
Um, uh, you want to
Um,
talk? Yeah, your name.
I have a question. So, the scenario I gave, I'm not sure. I just came up with it because it wasn't a question I had thought about before. So, is it a good response, or do I need to make some changes?
Yes, I mean, like it was good. It was good when I listened to it. Like, it's fine. Like just as I said, in the situations that we were disappointed, usually I'm thinking about exams more than patients, and the exams that wasn't real exams, something not important that he can judge me on. At the end of the day, I wanna get the job. I don't want anyone to judge me on something that I don't have any problem with that, right? So you can mention about uh, the patient service he's getting in the hospital. It wasn't that good. That is why you feel disappointed. That is one of the stories people tell. You can mention about patient is not taking his medication regularly, and this make you disappointed because the patient came to you later having very high blood pressure, diabetes not controlled, this makes you disappointed with the patient. So a lot of stories you can mention, but
Okay.
try in general to avoid the situations that will make you guilty, make you do the mistake, right?
Yeah. Thank you.
You're welcome. Jonathan?
So, during my step one preps, I scheduled to take the exam in another country, and I had to have a visa to enter that country, but my exam day was approaching, and the visa was not issued by the day I had to take the exam, and it just passed, so I had to reschedule by paying extra money, and I was really disappointed that
Yes, that's
happened.
fine. What was the country
But
at the time?
so I had to take it in Dubai, but
Okay, that's
visa
fine.
was not issued. So later on, I had to study again, revise some chapters, then go on, and I actually passed with my
Yeah,
initial.
that is good. That is
Thanks.
good example. That is good
Okay.
example. But you must mention the country because if you said visa issue and I don't know if it is US or not. So,
Yeah.
all right.
So, doctor, can we mention that someone isn't adherent to his medications because no one explain how to take the medications properly?
No, because this will make the problem on you. Like if you said, okay, I didn't explain the patient how to take, or you or anyone else, either you did the mistake or someone else of your friends did the mistake, which is makes you
Okay.
not appear good. But just to tell like a patient wasn't adherent, don't mention the reason. Next question.
Excuse me, can I
Yeah.
just mention something about like the my career transition? Like when I first came to the US, I wasn't expecting like the USMLE process like is that long and that complex. I was expecting to jump into clinical practice right away, and after that, I realized that it takes like years to pass the USMLEs and get certified, and then get the hands-on clinical experience. Can I mention something about that?
Can you repeat again, please?
Like what I was saying, like, can I mention that I was disappointed when I first came to the US? I wasn't aware that the USMLE process takes that long. I was expecting to jump into clinical practice right away. I felt disappointed that I wasn't able to jump into into patient care quickly. So can I mention something about
You
about
can
that?
mention that. You can mention that, and you can, but you have to continue that. You started to work on the exams, and you did your exams, and now you are applying for the job,
Okay,
right?
thank you.
Right.
Okay.
Yeah. So the
Hi,
next, yeah.
I wanted to ask that can we mention that the patient situation got worse due to lack of awareness or lack of education,
No,
something like that? No.
no, I don't prefer. You can mention, but I don't prefer to mention something I did wrong in my life, even if
Yeah,
even if I did.
because if we okay. Because if we mention non-compliance of the patient, non-compliance of the patient medication, so maybe there is some reason
So
behind
the
this.
next question, if he asked you why the patient wasn't compliant to the medication, because the patient didn't like to take it.
All right.
Okay.
So nothing's on
Right?
the system.
No, I'm not doing mistakes. I mean, like, you're applying for the job, so you have to appear in a good way.
Yeah, you have to
But if
respond.
you mention
Yeah.
that I forgot to tell the medication how to take it, okay, so how can I hire you? All right.
Yeah, all right. All right. Thank you.
Sometimes you don't have to be honest about everything. Okay, that's
Yeah.
next question. This will be for Ishita. You can answer this one. What makes you give up? Or let's ask.
This is,
Yeah,
I'm there. I'm there. I'm sorry.
you're here. Okay.
What makes
Give
me give
up.
up? Uh, well, it is very difficult for me to give up, which is evidence in my journey itself, because when I started preparing for
هذا
USMLE, my when I started preparing for USMLE, my father was diagnosed with idiopathic pulmonary fibrosis, and then he went on the transplant list and he passed away before I could give my step two. But I did not give up. I continued on this journey, and today I'm applying for internal medicine. So I would say that the threshold for me to give up is very high. However, things that make me give up is I sometimes give up on people, especially when they show certain values which totally do not align with me, like dishonesty, and they are disloyal, or they are they actually do actions that harm people. That is what makes me give up on people. But otherwise, in my journey, in my work, I don't think I am a person who would give up.
Okay, that is good. Also, I would like to add, um, I can say like I never give up, but I can only give up if I don't believe in this thing. Like let's say I was believing to do something like this. After that, when I don't believe in doing something, okay, so now I can give up and I can change the way to another thing. Right?
Okay.
All right,
Yeah.
great. Um,
Can we also say that it's important as a person to be able to like recognize when it's time to give up? Or
yes,
is that too negative?
very
Right.
important because it is normal to give up at some point of time. Okay,
Mm-hmm.
it is normal.
Right. Okay.
Um, Let me ask this question to El Gharabawi. Are you here?
Yes.
Okay,
Okay.
great. So the question now for you, what you are going to do if you find your senior resident is abusing you?
Mm-hmm. And the situation occurred with me. Okay. I, in my personal opinion, I will begin by comforting him and saying that if something went wrong for me, we can deal with it first. And if he does not respond to what trying to comfort him and trying to persuade him about my situation, I can just go to our senior and talk to him and try to resolve the problem with him about between us.
Okay. So in general, in such situation, you can say first, I have to talk to him and
Hmm.
discuss everything, discuss why he did that. And after that, if he acknowledge, okay, that's fine. But if he still doing the same thing every other time, so I can report him to my chief resident, right? Or report
I
his,
should say report or say
or tell
about a
I
discussion.
can talk to the chief resident.
Yeah. Okay. Okay.
But I mean, like, some situation you have to escalate. But first,
Okay.
before you escalating to the chief resident, you have to talk to your senior resident and talk with him
Hmm.
and discuss why and how. And if I did something wrong, I'm gonna apologize. So you have to appear in a very modest way.
Okay. Okay. Thank you.
Doctor,
So yeah,
If I'm not mistaken, in this question, we're supposed to, like, they want us to advocate and try or attempt to solve the problem ourselves. If it doesn't work, we escalate and we make sure it doesn't affect patient safety, right?
yes, that's correct. If patient safety, always you have to report. All right. That is the answer from even your word. But we don't do this in real life. Most likely, even in real life, we discuss together before escalating. Yeah. You can, someone raising your hand? Yeah, you can talk.
Okay, yeah. Okay. So I was going to ask, for this kind of question, do we have to give a scenario of an experience we've had about it before, or we can just answer straight
If you
off?
have, you can tell. But not everyone has work experience in home country. Some people, like, very fresh grads, so you don't have work experience with seniors.
Okay.
But if you have, you can tell.
Okay. Thank you.
So the next question will be what you are going to do if you find your junior resident not doing his work by the right way. And this question will go to Shad. You can answer this.
If I'm the senior resident and I find my junior or my medical student not doing the job the right way, I would try and teach them, hopefully, or I would stop them if I don't have the time and then take them aside, tell them what they're doing wrong, give them constructive criticism. And if it still keeps happening, I'm just going to write them a bad evaluation. I don't know.
First, how can I approach this type of question? I'm gonna I'll tell I'm always blaming myself. Maybe I didn't teach my junior resident the right way. So I'm gonna teach him again. After that, I'm gonna ask him to do the task. I'll try to figure out why he don't do these things by the right way. If he can teach, if he can learn how to do things by the right way, it's fine. But if he cannot, so at this point, I have to tell the program leadership about what is going on, what is happening. But first, I have to teach him, and I have to make sure he understands what I'm saying. Right?
Yes.
All right, great. Um, so this question will be someone here who I can ask this question to. Abdullah Ahmed, are you here? Nihal Said, are you here?
Doctor, I'm here.
Yes,
Yes.
Dr. Abdullah here.
Yeah, okay.
I'll ask first.
Nihal can answer this. It's fine. Um, tell me about it. Tell me about a challenge you faced during your way to United States residency.
While I'm waiting for residency,
Yes, challenge happened to you while you are like during the whole way of the residency.
so I don't have a challenge during residency because I didn't do residence till now. So
Not residency, during the way to reach to this point while you are now in the interview. So before.
before, yeah. So I can remember challenge.
Okay, Abdullah, you can answer if
Yeah.
you have a challenge. Okay,
Yeah,
Abdullah.
I have a challenge. Actually, 1 month before doing my step to CK exam, during residency, I was relocated to another city that is 80 kilometers away from my home. So it was a little bit it was kind of challenging doing my clinical duties and also preparing for my step to CK and going all these kilometers from home to work. But at the end, um, I kept my clinical duties. I showed discipline, and I scored very good in step two.
Okay, great. That is great. The same
Doctor,
thing
can we
also.
talk
Yeah.
about visa challenges?
No, no.
What about how it's really hard to get a place to do rotations in the US, especially
Mm,
without a VSLO?
So let me explain more than one thing, okay? Visa issues, you shouldn't mention anything about it, even if you have an issue before. Because if you told me now you got rejection in your visa or you didn't get an appointment for a visa, so most likely they will not rank you very high because they don't want their program to enter in a soup waiting for you to come and you didn't come because of the visa issue you had before. So most likely if a person that had visa issue before, most likely he will gonna have another visa issue in the future. So my opinion, try to be away from any visa issues. All right, even if it happened with you. The other thing also regarding the things that challenges to all of IMGs and also to be in the safe side, my opinion, try to talk about, okay, I'm leaving my family behind in my home country. Okay, I'm facing also changes in the culture, changes in the healthcare system. All of these are challenging even to me, even to anyone from us. We are changing everything. But visa issues and this stuff, I don't recommend you to talk about.
Can we mention financial difficulties,
I don't like
challenges?
also, I don't like, for my personal opinion, I don't like someone to talk about financial opinion during interviews. Because if you're gonna hire you, you should be rich, right? No one want to hire someone poor. I'm just, no, like, at least to be in, like, at the same level. So we all have financial problems during applying for residency, right? Even
Can
me, I
we
had a financial problem, but I didn't like to talk about it.
can we portray it like we had the financial difficulties, but I did jobs and I overcame this?
Yes,
Something like this?
that is in this scenario, it is good because what I did even while I was in Egypt, I was working for 4 years. I collected some money. So when I came to US, I was doing here unpaid research. So I was spending on myself from this money, right?
Okay.
So we all have the same problem, but I mean, like, focus more on the solution, not on the problem itself.
Can I answer now, Doctor?
Yes, sure.
So I have a challenge in my research because my mentor in Egypt, he was refusing to leave Egypt and continuing my research without existing in Egypt. But I was able to convince him because I can continue my research, and I was going on vacations each summer to continue or complete my experiments. And finally, I published this research, so it was a challenge in my journey.
So, I mean, the situation is, was you were living in Egypt and you did the research in Egypt?
Yes,
You couldn't
in,
come to America to do this research
to
and you
continue
published
my
it.
research, yeah,
Yeah,
because it's
and
a
you
basic
published it.
science. Yes, I published in European journal.
Yeah, but you have to mention also that basic science not common in Egypt. So it was a challenge for me to do basic science while I was in Egypt.
Yeah, pharmacology. It was pharmacology. So I have a senior mentor, and he was completely refusing to leave Egypt and continue my research. But
Okay.
I was able to convince him that I can continue my research.
Okay, great. That is a good answer, actually. Let me ask Jose, are you here?
Yes, I'm here.
All right, great. So the question for you now, are you a team player? And give me an example.
Huh. Yes, I would consider myself a team player. An example, I mean, I could say, for example, I worked after med school here in in Dominican Republic, which is where I'm from. We have to do a postgraduate year of clinical experience. So in this experience, I worked with several other we are called pasantes or just like interns, and we were about six. And for example, whenever one of them, for example, couldn't go to their on-call weekend or whatever, then like us could step up if we could do it, and like it was no problem, and I was always willing to do this. And another example is one of my friends actually applied last year. So whenever she got an interview, as I was not applying, I always said like whenever you get an interview, tell me, I will cover for you. It doesn't matter. Don't worry about it. And then we'll so yeah, that's the example I would say.
All right, right. And also you can mention about if you are a leader on a team, if you were, if you have people under you, so how can you lead a team? One of the things you can mention also, you have initiative. Initiative means like if you are a leader on a team, you have to create an ideas. If there is new ideas, and you have to mention some examples regarding that.
Okay.
Like educational thing, if you are like, I was a leader on a team consistent of 9 co-workers while I was in Egypt. So I was thinking about things, how can I improve? How can I improve the patient service, the service that I'm providing to the patient itself? So you can find like some suggestions. That means you are a good team player.
Okay, yeah, sounds good.
In this question, can we mention about extracurricular activities where we were as a team working as a team player or as a leader?
Like example?
Like as a in a art society, I was the leader. I was the head of the HR department. I was the
Yes.
one who were connecting people and organizing events.
Yes, you can mention that. Can mention that you were a leader in this.
All right, thank you.
About yes. I was reading one of the messages. So yes, you can while you are talking about the challenges, leaving family, it is a challenge. Starting in a new healthcare system, it is a challenge. Changing the culture, all of these are challenges. So the next question is, all people saying they are hard workers. So give me an example why you are hard worker or how you are hard worker. Um, who can answer this one? Uh, Rabia Akram, you can answer.
Yeah, sure, I can answer this. Yeah, as you have mentioned that all the co-op applicants are, I'm sure, are very hardworking. Having said that,
Yes, but you have to give an example why you are hard worker, what you
can you
did.
hear me?
Yeah, I hear you now. No, I don't hear
Yeah.
you.
Due to some challenges during facing some challenges during my USML journey, I had to do some jobs to pursue this journey. So I was doing a 12-hour shift while studying for my step 2 CK exam. So but it is quite evident from my journey that I was quite resilient and hardworking, and I passed my exam with quite a good score, and I'm here in front of you. Yeah. So I
Yeah,
didn't
that's fine.
stop.
So what I'm saying, always in such situation, I was working, I was studying, and it ended up me was when I got the interview, and the reason behind I got the interview that means I'm a hard worker. So
Yeah, all right.
that's correct.
All right, thank you.
So the next question, what is the most important characteristic that should be present in a resident? Clinical knowledge or communication skills or intellectual intelligence or flexibility? Yeah, you can answer. One raised his hand.
Yeah, I would say all the qualities are required to become a good internal medicine resident.
Yes, but which one is more important in your
Be
opinion?
ability to be a good team player.
Yes. So my answer for this question, I think communication skills is much more better
Communication.
than even having a clinical knowledge because at the end of the day, we all will get the clinical knowledge. But having communication skills, you should have before starting the residency. So the question now, yeah. So the next one will go to Siham. You told us that uh, you have home country work experience before. So tell us now, how you deal with angry patient.
Hello. Do you hear me?
Yes, how you deal with angry patient.
I think I need to listen to them, listen to what's their complaint, because any angry person, they have something angry about. So I'll try to listen to that patient and understand what makes them angry.
Okay.
Yeah.
Then, so usually in such situation, the angry try to listen, as you said. After that, understand their concern. After that, you have to apologize if you did a mistake, and try to explain more what's going on in the situation. And you have to give an example. If they ask you something like this, just give an example. What happened with you before? Like, I can say, patient came to the ED. The patient has chest pain. This patient did an EKG diagnosed by MRI. So at the same time, also another patient came. Other patient has a common cold. So the other patient wanted to be examined before the critical patient. So in such scenario, I tried to explain more to the angry one, which was the patient that has common cold. I explained to him the situation, and he started to understand the critical case of the other one. Or I mean, like, that there is an emergencies present on the other side, right? So I mean, like, in such situation, you can talk about this. Also, I have another example for an angry patient. So I said this example before, that the patient asked me to explain to him blood work, but I didn't have the chance to go to explain to him. So patient was angry, so I apologized and I started to do my job. Right?
Okay. Thank you.
Great. Uh, okay. So the question now to Muhyiddin, if he is here, Muhammad Muhyiddin, if you are here. Um,
Yes, I'm here.
okay, great. So tell me about a situation you learned something from a patient.
I learned something from a patient. Uh, that's a tough question. Okay.
No, it is not tough. Just try to think. You're gonna get it.
Okay, I can remember that sometimes while I was in the ICU, and there was a patient who has been hand over and again every day as he has delirium. So I tried to talk to him and bring a seat and sit down and talk to him for about more than 40 minutes and figure out that he is panicking, he is not in delirium. He knows where is he and where he have been, and figured out that we sometimes assume that patients in the ICU they has delirium, but no, sometimes they are a little bit um angry or a little bit confused of why they are here and what's the plan for them here, especially if they are old age. So I learned something that we have to talk more to the patient and be patient while listening to them, even if we have a heavy schedule or something.
Okay, that's fine. That's a good answer. But in general, also, what I'm saying in such situation, I can say all my patient is a lesson to me, because every patient has a disease, and this disease is a teaching to me. And always, what I'm saying is every patient can teach you something regarding his illness. And the first teacher to any doctor is the patient. So any patient have come with you with the symptoms and signs of a disease, so it is a lesson to you to learn more about this disease. So that's also teaching point from the patient.
So, can you mention an example in this scenario?
So let's say patient coming to you with wheezy chest, okay? This is an asthma, right? Maybe an asthma.
Yeah.
So I learned about asthma from a patient, and I started to read more about it. So that is a lesson you learn. That is on the medical side of view. And Muhammad Muhi, he mentioned other thing, which is like, communication more. So you can
Yeah.
mention this or
Can you?
that.
Yeah. So, can you mention that we learn some positive attitude from a patient?
You learn it again, please.
A positive attitude when I told him about his disease. He was positive and he wanted to know about the next step. So I learned to stay positive in any situation.
Yes, you can say that. You can say, like, I learned to tell the patient his diagnosis in a positive manner, to focus more on the treatment more than focusing on the complication.
All right, thank you.
You're welcome.
So I want
Uh,
to share one of my experiences regarding that.
yeah, sure.
So during my hemato-oncology rotation, so I got one patient who has like incidental diagnosing of multiple myeloma, and she was a runner. And when she came for her follow-up visit, she was asking the attending like when I can go back to my running again. So I found it so much positive. Like she was very positive about life. So I learned that it's like no matter negative things happen in your life, you should keep going. So can I use that?
Yeah, you can. That's fine. That's good. Next question now. Tell me tell me a positive patient interaction. I think you guys all have positive patient interaction. Anyone want to answer this one? Uh, Noreen, I don't hear from you. Noreen, if you're here. Masuma, Shahdi Madi, can answer this one. Tell me a positive patient interaction with you.
Excuse me, Dr. Ahmed, can you
Yes.
explain what do you mean by positive patient interaction?
Like the meaning of this question is patient come to you in the clinic for sure, and you did the physical exam, and you set the diagnosis to the patient. You start teaching the patient about his illness, and the patient start to thank you, to say thank you about what you are doing to him. That is a positive interaction between you and the patient. And the patient come to you in the next visit, the patient start to improve his clinical condition. I think all of us has this in our life.
That's a bit
Like,
clear.
yeah. I mean, like, how many patients you treated? A lot. How many patients say thank you? How many patients, even after you treat him, start to like even give you a gift for something? Like, I know it is not legally allowed here in the United States, but I mean, like, how many patients do that? It's a lot. So positive patient interaction, easy question to answer. Then negative patient interaction. And I think you should prepare a situation, and before the interview, you should prepare for this question because most likely they're going to ask you this question. And on the other hand, also they're going to ask you about the negative patient interaction. So you have to prepare this and that.
So I can say that like, oh, sorry.
Yes, you want to ask a question?
So
Okay.
I can say about one of my positive patient interaction. Like I'm working as a clinical trial coordinator, and we got one patient who was screen failed. And then I talked with my PI and we did some minor protocol modification, and he got enrolled in our study. And when he got some drugs, trial drugs, in his 6 month follow-up visit, he was like in wheelchair bound before, and he was walking, and he was expressing his gratitude towards me to help me to be enrolled in the study. So I felt so great that I could help him in that way. So yeah.
Okay, that is good situation. So in general, just to try to prepare some stories between you and your patient, especially if you are an older grad and you have work experience in home country. So most likely they're gonna ask you what you did. Uh, I finished all my questions now, and I'm gonna start receiving questions from you guys. If anyone have a question I didn't answer, and in general, as I said, start from now sending letter of interest. Start to reach to the resident in the programs. Before you do interview with the program director, you have to ask the resident what he likes, what he don't like, and what kind of questions he ask in the interview, and how the interview schedule going, like how many minutes you have to be with the program director, how many minutes with the coordinator, how many minutes with the resident, how many minutes with the faculty members. So all of this you have to be in your mind before starting the interview. Also, you have to study the program very well, because the more you know about the program, the more that they will feel you are interested in them. Try to prepare some questions in the interview. Very important. 50% of the interview should be from you, questions from you to them. I remember one of my interviews, the program director he was looking in the CV. He didn't find even my CV. I was sitting for about 1 or 2 minutes. When I find him, he didn't talk. I started the conversation with him, tell me about yourself. I asked him this question because just I wanted to know. I want to open a conversations. He was just looking here and there about my CV. He didn't find it, so we start just talking. We didn't even ask anything in the interview. Only all the questions. It was just a friendly talking, nothing else. And as I said, the interview they do it only to know about you, to know your personality, to know how you speak English, if they gonna understand your English or not. That is very important. So if you are weak in English, you have to work on that. If you are weak in responding to questions, try to work on that. Try to practice a lot interviews with your colleagues. Very important to practice interviews. That's what I always say. And yeah, I wish you guys or everyone can match in his dream program, but also you can ask questions now. Muhammad, you can ask.
Okay, I have some questions because I don't have that much few clinical experience. I don't have any actually. I'd like to ask about the calls. What is the long call? What is the short call? What is the post call? Because these things I don't know a
The
lot
call, I mean, like in my hospital, long call means like you are working from 7 to 7, 7 a.m. to 7 p.m. Short call usually from 7 to 5. Okay, 7 a.m. to 5 p.m. And night call, night you will work from night 7 p.m. to 7 a.m. So if you are post call, if you are working from 7 p.m. to 7 a.m., so you are post call. You are not working the next day.
Okay, what's the schedule? 6+2 or 4+1? I know
All
this is
right.
inpatient and continuity clinic, but sometimes they mention.
It depends on the program. I can tell about my program. So we are working in my program 2.5 months of floors and ICUs and everything, and only 2 weeks of clinic. So during every block, so the block means 3 months. Okay, 3 months means a block. Every block we have 2 weeks of clinic, primary care clinic. Other programs, they do primary care clinic every week or something. They do a lot of primary care. We don't do that. We only do 2.5 months of floors and only 2 weeks of clinic. 2.5 months of floors and 2 weeks of clinic. Floors means not only the floors, means consider elective, consider ICU, step down, telemetry, cardiology, pulmonology, any other electives. Consult service, all this. And also the schedule for the intern is different than the schedule for the resident. Intern means the first year, resident means second, third year. We consider this in my program as a resident. So the schedule is a little bit different. Like intern, he has about 6 months of floors, but resident, 3 months or third year as me, only 1 month of floors.
Okay, in your opinion, do you think there are some questions that shouldn't be asked in the interview? Like, how many vacations do I have?
Yes, you shouldn't ask about vacations because you can reach to it on the program itself. Like in the website, you will know exactly. Or some people ask about the salary. No, you shouldn't ask about salary and this stuff. I can give you some examples. I told you before, like mentorship program and how to they evaluate you and this kind of stuff. Procedure wise, you can ask about like how many procedures I will do. This kind of question is good, but I mean, ask about vacation. You didn't start work to ask about the vacations, right?
Thank you so much.
All right, great. Yeah, you can ask your question, Bijay.
Dr. Alvari, thank you so much, first of all, for conducting this long session, for helping us even during your busy schedule and on this weekend. I wanted to ask, this session is recorded, if this recording would be available and how we could access it.
So I'm gonna upload it on YouTube, but just after I finish, after that I can tomorrow or day after tomorrow, I can upload it on YouTube. That's fine.
Thank you so much.
You're welcome. Yes, next question.
Okay, so my question, you already answered some bit of it, but I was going to add, is it okay to ask them what they feel or what they think an ideal resident is as part of a question for them?
Yeah, what is the ideal resident? Yes, that is a valid question. You can ask that.
Okay.
So they're gonna tell you like exactly ideal resident should come early in the morning, should leave late in the night, do your notes, write everything, no? That is the
Yeah.
stuff. The
Okay.
answer, you know the answer, okay? But I mean, like, to open a conversation, that's fine.
Okay. Okay. Thank you.
Anyone else has a question? Everything is okay with you guys? I wish you guys, everyone can match. And as I said before, start to practice interviews. I couldn't have the time to do everyone alone. So I tried to do it as a group so everyone can learn something from the other. That will be better. And yeah, everyone can find your friends that are applying also for the residency. Try to do questions with him. And this will help you a lot to improve even your fluency in English while you are talking. All
Thank you,
right.
Dr. Hawari, for having us and for this a lot of time. Thank you so much. This is
You are
highly
welcome.
appreciated.
Thank you so much, Ahmed. This is very helpful. Thank you.
You're welcome, guys.
Thank you so much,
Thanks so
Dr.
much.
Hawari.
Thank you so much, doctor.
Very grateful for your
Thank you so
time.
much.
Thank you.
Thank you so much,
Thank you.
doctor.
Thank you for your
It
time.
was very informative.
Thank you. Thank you, everyone. And yeah,
Totally informative.
we're
Yeah.
gonna in March, I'm gonna congratulate everyone about the match. Sure.
And we are going to congratulate you about your GI fellowship, inshallah.
Yeah, hopefully. Yeah. Thank you so much. Thank you, everyone.
Yes, Dr. Ahmed. Thank you.
Yeah.
See you
Goodbye.
soon,
Have a nice
See
day.
you soon.
Bye
Bye bye.
bye.